Okay, good evening, everyone. Hope all of you are doing fine. So, Dr. Naseer here. You are microbiology faculty at DBMCI. I heartily welcome all of you to this microbiology high yield session for FMGE, right? So, with that, guys, microbiology is considered one of the boring, volatile, factual, and most difficult subject. है ना, इस तरह से समझा जाता है microbiology. Yeah, yes, it is boring, no doubt in that. Yes, it is more factual, no doubt in that. And yes, it is volatile, no doubt in that. But telling that ये ऐसा ही है पढ़ लो, that is not right. सर हमको क्या करना है, हमें मिलकर क्या करना है? We have to simplify it. Simplify it means it is boring. We have to make it interesting. हमें interesting बनाना है. We have to make it interesting. It is volatile, right? We have to make it memorable, right? And it is factual because we won't learn concepts. We use mnemonics, we start mugging it up, and that's why we feel it is factual, but actually it is conceptual. Actually all subjects are conceptual, so we have to make it conceptual. So this is what we have to do. Then what happens? Microbiology will become interesting and you can answer the questions from microbiology. So with that, good evening, Prajwal. Okay, good evening all of you. Without wasting time, see, first of all, remember, right, we are not covering the entire microbiology, sir. This is 1.5 hour session approximately, where we are focusing on the high yield topics, must know topics from microbiology, right? Because whenever the session, these kind of sessions held, students say this is not covered, that is not covered. Obviously, how can anybody cover, right, entire microbiology in 1.5 hours? That is not possible. So usually, what I say is important organisms are 130. Important organisms are 130 for entrance exam. So 130, right, approximately, right, 130 organisms are important, and obviously it is not possible to cover everything in 1.5 hours. We are focusing on high yield topics. Okay, so with that, guys, I heartily welcome all of you to our microbiology high yield session for FMGE. With that, myself, Dr. Abdul Naseer, right, known as Dr. Blueprint. So with that, guys, let's begin. We are here to discuss microbiology. If I ask you, sir, what is microbiology? Sir, if you ask you what is microbiology, usually what students say is study of microbes is microbiology. A good answer, study of microbes is microbiology, no doubt in that. But why do we have to study microbes in the medical field? See, when you answer, right, what is microbiology, this, right, concern should get answered. Why do we have to study microbiology in the medical field? Answer is very simple, sir. We have to study microbiology in the medical field because they cause diseases, and we call these diseases as infectious diseases. So what if they cause diseases, infectious diseases? Sir, if they cause infectious diseases, we being doctor, we have to lab diagnose the infectious disease and we have to treat the infectious disease. That's why we have to study microbes in the medical field, right? Microbes in the medical field. Okay, so now how many types of infectious diseases we have? Based on how many types of microbes we have? Sir, we have 4 types of microbes: bacteria, virus, fungi, and parasites. We have 4 types of microbes: bacteria, virus, fungi, and parasite. So we have 4 types of infectious diseases: bacterial, viral, fungal, parasitic infectious diseases. Okay, so starting with bacterial infection. See, first of all, before we begin, you should have some basic idea about microbiology. So what is that? What is microbiology? I told you, study of infectious diseases. What do we have to study? Sir, we have to lab diagnose. We have to lab diagnose and we have to treat. As a doctor, there are 2 main purposes: lab diagnosis and treatment. So how to lab diagnose the infectious disease? To lab diagnose the infectious disease, we have 4 methods. One is microscopy, second is culture, and third is molecular method, and fourth is immunological method. Sir, we have 4 important methods to lab diagnose the infectious disease, whether it is bacterial, viral, fungal, parasitic. कोई भी infectious disease हो, हमारे पास 4 methods है जिससे हमें lab diagnosis कर सकते हैं. We have 4 methods: microscopy, culture, molecular, and any one of these 4 you have to take and you have to lab diagnose the disease. And finally, once you have lab diagnosed, you have to treat the disease. Okay, this is our work as a doctor. हमें बस इतना ही करना है. So now the question is, among these four, which one to prefer? because we can use all the four, but there is no need to use all the four. The question is which one to prefer. सर बस एक याद रख लेना चाहिए सर, माइक्रोस्कोपी देखो, all four methods can be done for all four types of microorganisms. Bacteria, virus, fungi, parasite है. For all the four we can do microscopy also, culture also, molecular also, immunological also. But आप एग्जामिनर को ये नहीं कह सकते ना चार भी कर सकते हैं, राइट? कौन सा आंसर करना है तो आपको जो चाहे आंसर कर लो. वी कांट से लाइक दिस टू एग्जामिनर, राइट? इट इज योर विश, विच एवर यू वांट टू सेलेक्ट. हमें एक प्रीफर करना है, आंसर एक ही करना है ना, आंसर एक ही करना है. सो दैट्स व्हाई सर वी शुड नो विच वन टू प्रीफर, विच मेथड टू प्रीफर. दैट इज बेस्ड ऑन द ऑर्गेनिज्म. देखो फॉर parasites we prefer microscopy. So for bacteria and fungi we prefer culture. दो हम माइक्रोस्कोपी करते हैं, we do microscopy for bacteria and fungi before culture, but microscopy is considered as preliminary method for bacteria and fungi. Final is culture. Parasites के लिए final is microscopy, bacteria and fungal के लिए final is culture. And coming to viruses, sir, for viruses we use molecular or immunology. Right, what is this? So this is the final lab diagnostic method. You have to remember this. The final lab diagnostic method for parasites is microscopy, for bacteria and fungi it is culture, for viruses either molecular or immunological method. Right, sir, what do you mean by microscopy? Microscopy means see the, so look under the microscope and identify the organism. Culture means grow the organism on the culture media, identify the organism. Molecular means gene, detect the organism. Immunological means detect the antigen, detect the organism. Right, sir. माइक्रोस्कोपी में सी द मॉर्फोलॉजी. मॉर्फोलॉजी का मतलब क्या है? अपीयरेंस, राइट? ये साला ऑर्गेनिज्म दिखता कैसा है पता होना चाहिए, तभी तो आइडेंटिफाई कर सकते हो. मॉर्फोलॉजी. कल्चर, ग्रो द ऑर्गेनिज्म ऑन द कल्चर मीडिया एंड आइडेंटिफाई द ऑर्गेनिज्म. मॉलिक्यूलर, डिटेक्ट द जीन ऑफ द ऑर्गेनिज्म एंड डिटेक्ट द ऑर्गेनिज्म. Immunological, detect the antigen of the organism and detect the organism. Right, this is how we detect the organisms. And preferred method for parasite is microscopy, and for bacteria and fungi is culture, and for viruses molecular or immunological method. Understood? Anyway, sir, we have these four methods to lab diagnose, and finally we have to treat the infectious diseases. Let's begin one by one. Okay, sir, without any delay, beginning with our session, starting with, sir, let's have an idea about these four methods: microscopy, culture, molecular, immunological methods. नहीं, आखिर ये methods है क्या sir? Superficially idea तो मैं दे चुका हूँ. Let's see, right, in detail. What are the questions we can get from this? Sir, if you talk about microscopy, the most common used microscope is bright field microscope or light microscope. Right, bright field microscope, और जो भी आपने यूज कर रखा है in your life, whatever microscope you have used, that is known as bright field microscope or light microscope. Sir, in bright field microscope you can see all organisms except thin organisms. Sir, thin organisms are not seen in bright field microscope because they are thin. बहुत बारीक होते हैं, दिखते नहीं है. They are thin. What to do? Take a microscope in which you can see thin organism. Sir, in which microscope you can see thin organism? Dark field microscope is a microscope in which you can see thin organisms. Sir, which are the thin organisms? If you take bacteria, sir, spirochetes are the thin bacteria. Sir, spirochete is not the name of the bacteria. Spirochete. Sir, spiral bacteria are known as spirochetes. Spirochete is a group name containing the bacteria which are spiral in shape. Okay, sir, spirochetes are thin bacteria. Because they are thin, they are not visible in bright field microscope. To see these spirochetes we require dark field microscope. And because you know spirochetes, because they are spiral in shape, they rotate spirally. ऐसा लगता है कि जैसे corkscrew घूम रहा है. Corkscrew motility. क्या बोलेंगे हम? Characteristic motility, corkscrew motility. But इतना ही है sir. Sir, one important question you get from microscopy. What is that one important question you get from microscopy? So the one important question what you get from microscopy is, how will you demonstrate the motility of thin organisms? Thin organisms का motility कैसे demonstrate करोगे? Your answer should be dark field microscope because it is not seen in bright field microscope. Understood? पहली बार समझ में आ रहा है ना? Right? We are not mugging it up. We are understanding it. So, and we know where to focus so that you can answer. Sir, culture की बात करते हैं. If you talk about the culture, right? Culture की बात करते हैं. If you talk about culture, sir, first grow the organisms and culture media. Culture media की बात करते हैं. Sir, we have very important culture media, sir. Nutrient agar. Very important culture media, nutrient agar. Sir, nutrient agar में you have to remember two organisms. एक येलो कलर कॉलोनीज प्रोड्यूस करता है एंड सेकेंड ब्लूइश ग्रीन कॉलोनी प्रोड्यूस करता है. On nutrient agar if you see yellow color colonies, it is Staphylococcus aureus. Fix hai, done. And if you see green color colonies, bluish green, it is Pseudomonas. Very important for entrance exam, never forget. On nutrient agar yellow color colonies, Staph aureus, bluish green color colonies, Pseudomonas. Pseudomonas. Two color, only two colors you have to remember. In the same case, when you talk about blood agar contains blood. Blood में होता है RBC. When organisms grows on blood agar, they lyse the RBC. Lysis of RBC is known as hemolysis. Lysis of RBC है ना. Sir, which organism causes hemolysis? आपको याद रखना है. You have to remember Staphylococcus aureus and Streptococcus. Staphylococcus causes beta hemolysis. Beta hemolysis means complete hemolysis. And when there is complete hemolysis, you see a clear zone surrounding the colonies. When you see organism growing on culture media, colonies दिख रहे हैं sir. Surrounding the colonies, I'm seeing clear zones, complete hemolysis, beta hemolysis, Staphylococcus or Streptococcus. Sir, surrounding the colonies, I'm seeing greenish gray color zone, not clear zone, greenish gray color zone, black, थोड़ा black color दिख रहा है sir, surrounding the colonies. Partial hemolysis, which is also known as alpha hemolysis, right? RBCs are broken down, but partially, not completely. Partial hemolysis is known as alpha hemolysis. And there is only one bacteria which produces, important bacteria is one which produces alpha hemolysis, which causes alpha hemolysis, pneumococcus. Very important for entrance exam. बीटा hemolysis कौन करता है, अल्फा hemolysis कौन करता है? पहली बात, बीटा hemolysis क्या है? कंप्लीट hemolysis है, कंप्लीट ब्रेकडाउन ऑफ आरबीसी. स्टेफिलोकोकस, स्ट्रेप्टोकोकस दो करते हैं. First two bacteria, no, everybody know first two bacteria, Staphylococcus, Streptococcus. Sir, partial hemolysis कौन करता है? Pneumococcus. याद रखना है, very important for entrance exam. Okay, now, sir, there is one bacteria that grows alone on chocolate agar. Chocolate agar पे खुद से grow होगा. It grows alone on chocolate agar. But blood agar it cannot grow alone. खुद से नहीं grow होगा. But if you want to grow on blood agar, you have to place Staphylococcus aureus. With the help of Staphylococcus aureus, it can grow on blood agar. This is known as satellitism. What is satellitism? देखो simple language में समझा रहा हूँ. In simple language, what is I'm not explaining the mechanism. In simple language, what is satellitism? So there is an organism that grows with the help of Staphylococcus aureus on blood agar. This is satellitism. But on chocolate agar, it can grow alone without the help of Staphylococcus aureus. Which is that organism? Sir, Haemophilus influenzae B. Sir, Haemophilus influenzae B is the organism that shows satellitism on blood agar, means it can grow with the help of Staph aureus on blood agar. Alone it cannot grow, but on chocolate agar it can grow alone. But these are the three very important points. Very important points. ठीक है? Nutrient agar, बोलो यार, everybody has to answer. Yellow color colonies, Staph aureus, bluish green, Pseudomonas. ये याद रख लो यार, easy है ना? Blue, Pseudomonas, BP याद रख लो, BP, right? एग्जाम में BP सबका लो हो जाता है ना? वरना एग्जाम से पहले तो सबका बड़ा हुआ रहता है, ओवर कॉन्फिडेंस. एग्जाम में पूरा लो हो जाता है ना बीपी. ब्लूइश ग्रीन कलर Pseudomonas, येलो कलर Staphylococcus aureus. Complete hemolysis, beta hemolysis, Staphylococcus, Streptococcus, right? Whereas partial hemolysis, pneumococcus, alpha hemolysis, right? Chocolate agar में खुद से grow होगा, it grows alone. On blood agar, it grows with the help of Staphylococcus aureus. This property is known as satellitism, Haemophilus influenzae B. Very important points. You also know these are very important. Right, high yielding points on the culture media. Nice, sir. Thank you, man. Thank you for live, sir. Actually preparing from world of revision, sir. Thought to revise again. Came live. Very good, man. Thank you. Okay, these are the important points in culture media, sir. After growing on the culture media, right, you have to perform the tests to identify the bacteria. That is known as biochemical test. Biochemical test. Sir, there are many biochemical tests. Sir, there are many biochemical tests, but we have to discuss important biochemical tests. राइट सर, विच आर द इंपॉर्टेंट बायोकेमिकल टेस्ट? देखो, पहला इंपॉर्टेंट बायोकेमिकल टेस्ट आपको याद रखना है, कैटालेस. विच वन? कैटालेस. सर, कैटालेस, व्हेन यू डू कैटालेस टेस्ट, दो रिजल्ट मिलेंगे, आइदर पॉजिटिव और नेगेटिव. नो, वेरी सिंपल, आइदर पॉजिटिव और नेगेटिव. सर, कैटालेस पॉजिटिव कंफर्म कर लो, स्टेफिलोकोकस. कैटालेस पॉजिटिव स्टेफिलोकोकस. कैटालेस नेगेटिव स्ट्रेप्टोकोकस न्यूमोकोकस. Streptococcus, pneumococcus. Okay, three bacteria you have to remember. Catalase positive Staphylococcus, negative होगा तो Streptococcus, pneumococcus. अब when you know it is Staphylococcus, the next biochemical test what you perform is coagulase. Sir, coagulase positive Staphylococcus aureus species Coagulase negative means cons. Cons मतलब coagulase negative staphylococcus means remaining species of staphylococcus other than aureus. देखो स्टेफिलोकोकस कैटालेस पॉजिटिव है, ये पहली बात फिक्स रखना है, दिमाग में फिक्स कर लो, कैटालेस पॉजिटिव स्टेफिलोकोकस. अभी देयर आर मेनी स्पीशीज ऑफ स्टेफिलोकोकस. हाउ टू आइडेंटिफाई द स्पीशीज? यू परफॉर्म ऑरियस. You perform aureus. You perform coagulase test. Coagulase positive means aureus. Negative means cons. Negative means cons. ये हो गया सर फर्स्ट पार्ट. Catalase and coagulase. Two tests you have performed. You identify staphylococcus. Catalase coagulase perform करके identify staphylococcus. ठीक है. Then catalase negative. Sir, catalase negative two possibilities: streptococcus or pneumococcus. How to confirm? Sir, perform bacitracin sensitivity. Bacitracin is an antibiotic. Bacitracin sensitive means bacitracin is killing streptococcus. If bacitracin is killing streptococcus, it is group A streptococcus, which is known as streptococcus pyogenes. And if CAM test is positive, it is group B streptococcus, which is known as streptococcus A galactiae. And if it is optochin sensitive and bile soluble, optochin sensitive and bile soluble, it is pneumococcus. It is pneumococcus. So this is how we can identify. Sir, catalase negative, you have to identify two organisms, streptococcus, pneumococcus. To identify streptococcus, you have to perform bacitracin sensitive group A streptococcus, CAM test positive group B streptococcus. Right. And if optochin sensitive and bilesculin positive, sorry, bile soluble, optochin sensitive, bile soluble, it is pneumococcus. So three bacteria you have to identify: staphylococcus, streptococcus, pneumococcus. And one more important biochemical test, string test. String test positive vibrio. String test positive vibrio. देखो ये giardia also gives string test positive, salmonella also gives string test positive. The string test is different, okay, it's different. In exam when they say string test positive, you say just vibrio. Exam के लिए you say just vibrio. No need to remember where and all the string test will be positive. Exam if you hear string test positive, close your eyes and answer vibrio. So these are the important biochemical tests. Right? Once again I'm telling you answer. Catalase positive means you say staphylococcus. How will you confirm it is aureus? Coagulase positive aureus, otherwise cons. Catalase negative. Sir, catalase negative streptococcus pneumococcus. पहले narrow down करना है. How will you confirm? Bacitracin sensitive group A streptococcus, CAM test positive group B streptococcus, optochin sensitive and bile soluble pneumococcus. Done. Last में sir string test positive vibrio. Vibrio. Right. Sir, coming to the immunological test. Coming to immunological test. See, there are many immunological. What do you mean by immunological test? We have discussed immunological test means the test that detect antigen or antibody. There are many immunological tests, but important. High yield for entrance exam. High yield for entrance exam. Sir, VAT, SAT, MAT. पहले ये तीन याद रख लेना है. VAT, SAT and MAT. VAT means Vidal agglutination test. Everybody knows, सबको पता है salmonella. SAT means standard agglutination test. याद रखना है brucella. MAT means microscopic agglutination test. याद रखना है leptospira. Sir, Vidal, salmonella, standard, brucella, microscopic, leptospira. इस तरह से दो तीन बार याद करोगे, याद हो जाए. निमोनिक बनाना है आप बना, you can make it. It is your choice, right? But if you study in small doses and if you revise, you can easily remember. Small doses means don't try to remember everything at once. You can't remember. Always remember हमारा brain का capacity क्या है. Sir, maximum our brain can remember 3 at once. Maximum our brain can remember 3 at once. So more than 3 you should not give it to your brain. ये की है याद रखने का. अब जैसे सर VAT, SAT and MAT दो तीन बार रिपीट करना है. Vidal for salmonella, standard for brucella, microscopic for leptospira. Like this only in exam it will come: Vidal, salmonella, standard, brucella, microscopic, leptospira. And you should keep revising intermittently. ठीक है? Right. Mnemonic you can make it if you want. Coming back to here, sir, Wheel Felix test, LX gel precipitation test. Right. Next three: Wheel Felix test, LX gel precipitation test, Niegler's reaction. Wheel Felix test. You know, Wheel Felix test where we had three antigen: OXK, OX2 and OX19. We had three antigens. OXK positive is by Orientia susugumushi. First of all, you should know this is the name of the bacteria. Orientia susugumushi. आपका फेवरेट है ना susugumushi. क्या करता है? स्क्रब टाइफस करता है. स्क्रब टाइफस करता है. It gives OXK antigen positive in Wheel Felix test. Very important, most common repeated in entrance exam. Right? Most common repeated in entrance exam. ठीक है? Orientia susugumushi causes scrub typhus, gives OXK antigen positive in wheel Felix test. Rickettsia gives OX2 and OX19 positive. अब Rickettsia OX2 OX19 पॉजिटिव होता है, दैट इज नॉट दैट इंपॉर्टेंट, बट ओरियंशिया सुसुगुमुशी वो XK पॉजिटिव देता है इन व्हील फेलिक्स टेस्ट इज वेरी वेरी इंपॉर्टेंट. Alex gel precipitation test positive for Corynebacterium diphtheria, Naegler's reaction positive for Clostridium perfringens. Right, sir, 3 plus 3 6 important immunological tests. So with that you got an idea, sir. Sir, हमने कवर किया है माइक्रोस्कोपी, then culture. After going on the culture media, identify by biochemical test. तो माइक्रोस्कोपी एंड कल्चर हो गया, फिर इम्यूनोलॉजिकल टेस्ट हो गया. मॉलिकुलर टेस्ट तो पीसीआर, molecular test is PCR that you study in biochemistry. So with that we are now starting with what, sir? With that now we are starting with bacterial infectious diseases. With this introduction we are starting with bacterial infectious diseases, and especially the high yielding means the most common repeated in the entrance exam. So the most common repeated in the entrance exam from bacterial infectious diseases is bacterial meningitis. सर से ही स्टार्ट करते हैं, सर से स्टार्ट करके हमारा सर खा लेते हैं, है ना. सर बैक्टीरियल मेनिंजाइटिस, बैक्टीरियल मेनिंजाइटिस बहुत इंपॉर्टेंट. व्हेन वी टॉक अबाउट बैक्टीरियल मेनिंजाइटिस, देखो उसको 3 पार्ट में डिवाइड करना. यू हैव टू डिवाइड बैक्टीरियल मेनिंजाइटिस इनटू 3 पार्ट्स. acute bacterial meningitis in adults, acute bacterial meningitis in neonates, chronic bacterial meningitis. 3 पार्ट में डिवाइड करना है एंड वी हैव टू डिस्कस इन 3 डिफरेंट पार्ट्स. पहला स्टार्ट करते हैं सर acute bacterial meningitis in adults. ठीक है. फर्स्ट ऑफ ऑल सर, हाउ विल यू कम टू नो दैट पेशेंट इज सफरिंग फ्रॉम acute bacterial meningitis? पता कैसे चलेगा? राइट, फर्स्ट ऑफ ऑल यू हैव टू सी द साइंस. नेक रिजिडिटी, नेक रिजिड हो गया, ब्रुडजुम की साइन पॉजिटिव, कर्निक साइन पॉजिटिव, एनी वन ऑफ दीज साइंस पॉजिटिव, आपको डायग्नोसिस करना है पेशेंट को है मेनिंजाइटिस. First, we have diagnosed meningitis is there because patient is manifesting with neck rigidity, Brudzinski sign or Kernig sign. These are the signs of meningitis. And once you diagnose meningitis, now you have to decide acute or chronic. For that, you have to take the CSF and you have to do CSF analysis. In CSF, if you see highly elevated neutrophils, highly decreased glucose, it is confirmed acute bacterial, right? Pneumococcus. Okay. Sir, 3 important bacteria: pneumococcus, meningococcus, Haemophilus influenzae B. Right, these are the 3 important bacteria which causes acute bacterial meningitis in adults. Now we have already diagnosed it is acute bacterial meningitis. Adults में 3 bacteria: pneumococcus, meningococcus, Haemophilus. Sir, the most common overall causing acute bacterial meningitis in adults is pneumococcus. Most common कौन सा है? Pneumococcus है. Most common in northern India, associated with petechial rashes. Petechial rashes means bleeding rashes. Is meningococcus. Meningitis, most commonly in northern India, associated with petechial. Petechial rashes is very important. Bleeding rashes. Meningococcus. And most common in children, not neonates, children, is Haemophilus. Right, Haemophilus. Sir, most common overall is pneumococcus. Most common in northern India associated with petechial rashes is meningococcus, and most common in children is Haemophilus. Okay, fine, sir. How will you confirm it is pneumococcus? Optochin sensitive, bile soluble, है ना, we have already done. देखो हमने बता दिया ना, कहाँ पे? यहाँ पे सर. Right, where? Optochin sensitive, bile soluble, biochemical test. Biochemical test. Then confirm it is pneumococcus. Pneumococcus. Sir, Thier Martin medium में grow हो रहा है, the bacteria is growing on Thier Martin medium, meningococcus. Haemophilus, right? Blood agar mate can grow with the help of staph, or yes, chocolate agar mate can grow alone. That property is known as satellitism. Hey, we have already discussed. And a satellitism grows on blood agar with staph, or yes, but on chocolate agar it can grow alone. Known as, this property is known as satellitism. Haemophilus. Hey, देखो how easy it has become now. Because you know the basics. Optochin sensitive, bile soluble है, confirm हो गया सर. Pneumococcus growing on Thier Martin medium, sir. Meningococcus Grows on chocolate agar alone, but on blood agar requires staph aureus. That is known as cephalitism, sir. Hemophilus. Once you are confirmed, you have to treat. Treatment is vancomycin plus ceftriaxone. Done with acute bacterial meningitis. Simple है ना? Right. First of all, I have told you how to diagnose meningitis. Exam में बता रहा हूँ. Exam में, in exam when you see the question, how to diagnose meningitis? Neck rigidity, Brudzinski, Kernig sign. Out of these three, anyone is there, I will diagnose meningitis. How will you decide it is acute? I will do CSF analysis. Highly elevated neutrophils, highly decreased glucose. Neutrophil बढ़ा हुआ है, glucose घटा हुआ है, sir. Acute. Narrow down to three: pneumococcus, meningococcus, hemophilus. Narrow down, sir. How will you identify? Most common is pneumococcus. It is optochin sensitive, bile soluble. Most common in northern India, associated with petechial rashes, bleeding rashes. Meningococcus confirmed the growing on Thayer Martin medium. Most common in children is hemophilus, confirmed by satellitism. And once you are confirmed, start the treatment vancomycin plus ceftriaxone. देखो मजा आया ना पहली बार, right? When you learn, you will enjoy. When you mug it up, it is boring. Learn करना, you have to learn. Sir, learn करने से question समझ में आएगा. See, what I have seen, the students who try to mug it up, they mug it up. But when they see the question, they can't understand the question. Question ही समझ में नहीं आता है, फिर आंसर गलत हो जाता है. फिर पर्सनल सेटिस्फैक्शन के लिए हम क्या बोलते हैं? सिली मिस्टेक. पर्सनल सेटिस्फैक्शन हम बोलते हैं सिली मिस्टेक. नहीं, समझ के पढ़ना था ना. समझ के पढ़ोगे तो क्वेश्चन समझ में आएगा. If you understand while reading, then you will understand when you see the question. When you understand, you can answer it right without silly mistake. Why silly mistake it happens? Because we never try to understand. That's it. Hope you are enjoying. So with that, acute bacterial meningitis in adults हो गया. अभी acute bacterial meningitis in neonates. Sir, in neonates, acute bacterial meningitis in neonates. Again, meningitis is same, sir. When you see neck rigidity, Kernig sign, Brudzinski sign, you will diagnose meningitis. Highly elevated neutrophils, highly decreased glucose, you will say it is acute. You will say it is acute. If the age group is neonates, three bacteria, sir: Group B, Streptococcus, E. coli, and Listeria. How will you confirm, sir? Group B Streptococcus is most common in the world, causing neonatal meningitis, and it is CAM test positive. We have already discussed. CAM test positive group B streptococcus. देखो याद रखना चाहिए biochemical test. Sir, in biochemical test we have told decitrazine sensitive, group A streptococcus, CAM test positive, group B streptococcus. तो अभी group B streptococcus आया तो CAM test आ गया सर. CAM test positive group B. Sir, most common in the world causing neonatal meningitis is group B streptococcus, and it is CAM test positive. Most common in India causing neonatal meningitis is E. coli. And Listeria is a bacteria which causes neonatal meningitis, which shows differential motility. Listeria क्या दिखाता है? Differential motility. Sir, what do you mean by differential motility? Difference in motility with respect to different temperatures is differential motility. मतलब sir, Listeria is motile at 22 to 20 से 25 degrees Celsius में Listeria is motile, showing tumbling motility. But at 37 degrees Celsius it is non-motile. 37 degrees Celsius में क्या है? It is non-motile. Motile at one temperature, non-motile at another temperature. इसको बोलते हैं differential motility. And when Listeria is motile, it shows a characteristic motility, tumbling motility. Right. And once you confirm, treat ampicillin plus ceftriaxone. देखो adults में हमें यूज करना है vancomycin and ceftriaxone. Neonates में यूज करना है ampicillin plus ceftriaxone. One drug you have to change. Group B streptococcus कैसे कंफर्म करोगे? CAM test positive. Listeria कैसे कंफर्म करोगे? Differential motility. E. coli no need to confirm. Right? No need to confirm. Okay? सर ये हो गया acute bacterial meningitis in neonates. अभी chronic bacterial meningitis. Sir, how will you diagnose chronic bacterial meningitis? First, you diagnose meningitis. How will you diagnose meningitis? वो तो हमें पता है सर. Neck rigidity, Brudzinski sign, Kernig sign, meningitis. Very good man. अब तो आप expert हो. You are expert now. Then we do CSF analysis. When we do CSF analysis, increase in lymphocytes, increase in protein. Lymphocytes बढ़ा हुआ है, protein. Increase in protein. Very important. Sir, very very important. Multiple stars. When you see CSF में protein increase हुआ है, chronic bacterial meningitis. And chronic bacterial meningitis is caused by Mycobacterium tuberculosis. How will you confirm Mycobacterium tuberculosis? Sir, first step is acid fast staining. Confirmatory step is CB-NAT. confirmatory test is CB-NAT. Confirm हो गया सर. Treatment 2 HRZE 10 HRE. But sir 2 HRZE 4 HRE है ना सर. 2 HRZE 4 HRE है ना. That is for pulmonary tuberculosis. Pulmonary tuberculosis के लिए 6 months treatment, 2 months plus 4 months. Tubercular meningitis. Tubercular meningitis means meningitis caused by Mycobacterium tuberculosis. 12 months treatment, 2 months HRZE, 10 months HRE. And you know what is HRZE? H means isoniazid, R means rifampicin, Z means pyrazinamide, E means ethambutol. After 2 months, stop Z, stop pyrazinamide. Continue 3 drugs for 10 months. So this is chronic bacterial meningitis. Sir, chronic bacterial meningitis, how will you diagnose? Highly elevated protein. तो chronic bacterial meningitis कौन करता है? Mycobacterium tuberculosis. कैसे कंफर्म करोगे? Acid fast and CB-NAT positive confirm. Treatment क्या करोगे? 2 HRZE plus 10 HRE. How simple it is. Done with meningitis. पहला topic हो गया meningitis. 3 different parts. We have divided into 3 parts and we have discussed it. We have discussed this, right? We have discussed everything clinically, how it manifests, lab diagnostically, how to confirm treatment. We have discussed everything, clinical diagnosis, lab diagnosis, treatment, right? And so this is, we have focused on adults in this page, neonates, in this page, chronic bacterial meningitis. Sir, everything is getting mixed up after reading. How to avoid? Right? You can't avoid when there are so many organisms. You have to read repeatedly and you have to read in small doses. That's it. Sir, coming back to here. Central nervous system will come down to cardiovascular system. Sir, cardiovascular system. In cardiovascular system, we'll discuss one important disease, which is that, sir, acute rheumatic fever, ARF. Acute rheumatic fever, which is caused by group A streptococcus. Group A streptococcus causes acute rheumatic fever. How will you diagnose? Modified Jones criteria. How many criteria are there? 5 major criteria, 5 minor criteria. देखो 5 major criteria, 5 minor criteria, 10 criteria, difficult to remember, right? And what you do is you make mnemonics. That is your personal choice. You can make mnemonics, no doubt in that. But my method is we avoid mnemonics, because what I believe is so many mnemonics. See, few mnemonics are helpful. Too many mnemonics difficult to remember. So now how I remember this is 5 major, 5 minor criteria. What to do? Sir, divide कर लो ना, 2, 1. 5 major criteria. Which are the 5 major criteria? First, focus on major criteria. Pancarditis and polyarthritis. Pancarditis, entire heart gets involved. Polyarthritis, multiple joints gets involved. Then skin and subcutaneous manifestation. Skin manifestation, erythema marginatum, red color rash, erythema marginatum, right? Margins are red. Red color rash with margins are red. Subcutaneous nodules, sir, erythema marginatum and subcutaneous nodules. फिर Sydenham's chorea. 5 major criteria. 2 + 1. Pancarditis and polyarthritis, erythema marginatum and subcutaneous nodules, Sydenham's chorea. अब जैसे 5 याद हो गया, अभी 5 माइनर क्राइटेरिया. फीवर एंड पॉलीआर्थ्राल्जिया. देखो यहाँ पे ध्यान देना है, पॉलीआर्थराइटिस मेजर क्राइटेरिया, पॉलीआर्थ्राल्जिया माइनर क्राइटेरिया. अगेन मोनोआर्थराइटिस सब होता है. लो रिस्क इंडिविजुअल, हाई रिस्क इंडिविजुअल. सी इफ यू इंक्लूड ऑल दोज यू विल गेट कंफ्यूज्ड. कीप इट सिंपल, क्योंकि एग्जामिनर क्वेश्चन क्या पूछेगा? एग्जामिनर विल आस्क अमॉन्ग द फॉलोइंग क्राइटेरिया विच आर इन द मेजर क्राइटेरिया, विच आर इन द माइनर क्राइटेरिया. तो इफ यू नो दिस, दैट इज इनफ, राइट? अभी माइनर क्राइटेरिया, फीवर एंड पॉलीआर्थ्राल्जिया. यहाँ पे कंफ्यूज नहीं होना है. पॉलीआर्थराइटिस इज मेजर क्राइटेरिया, आर्थ्राल्जिया इज माइनर क्राइटेरिया. सर, इंक्रीज्ड सीआरपी एंड इंक्रीज्ड ईएसआर. सर, प्रोलॉन्ग्ड पीआर इंटरवल. सर, याद रख लो 2 + 2 + 1, राइट? फीवर एंड पॉलीआर्थ्राल्जिया, इंक्रीज सीआरपी एंड इंक्रीज ईएसआर, प्रोलॉन्ग्ड पीआर इंटरवल. इजी याद रखने के लिए. सर, टेल मी द 10 criteria, 5 major, 5 minor. Pancarditis and polyarthritis, erythema marginatum and subcutaneous nodules, Sydenham's chorea, fever and polyarthralgia, increased CRP and increased ESR, prolonged PR interval. 5 major, 5 minor criteria. Treatment है penicillin. हो गया सर acute rheumatic fever. The most common question what they ask is, among the following which come under major criteria, which come under minor criteria. If you remember the criteria, done. And it is caused by one bacteria, group A streptococcus. So the next important topic है sir tuberculosis. Tuberculosis is examiner's most favorite topic in FMG. ऐसा पेपर ही नहीं जाता है कि ट्यूबरक्लोसिस से क्वेश्चन ना आए. वेरी डिफिकल्ट, वेरी रेयर पॉसिबिलिटी दैट यू वोंट गेट ए क्वेश्चन फ्रॉम ट्यूबरक्लोसिस. वेरी इंपॉर्टेंट ना, डेप्थ में पढ़ना है. ट्यूबरक्लोसिस यू हैव टू स्टडी इन डेप्थ. Right, if you talk about the tuberculosis, so tuberculosis is caused by Mycobacterium tuberculosis, and tuberculosis affect multiple sites in our body. The most common site is lung, pulmonary tuberculosis, and there are other sites involved, extrapulmonary tuberculosis. Sir, pulmonary tuberculosis manifestations are evening rise of fever. Evening में fever बढ़ता है, cough for more than 2 weeks, weight loss. These are the three important manifestations of pulmonary tuberculosis. जब lung involve होता है. Extrapulmonary tuberculosis, or what are the manifestations? That depends on site, है ना. अब extrapulmonary means other than lung, lymph node involved हो सकता है. If lymph node is involved, what is the manifestation? Lymphadenopathy. Meninges can be involved. What are the manifestation? Neck rigidity. वो तो हम we have already discussed. Okay, chronic bacterial meningitis caused by Mycobacterium tuberculosis हमने discuss किया है. Meninges involved होंगे, meningitis, chronic bacterial meningitis, increase protein. Chronic bacterial meningitis means immediately two things should come to your brain. Increase protein, Mycobacterium tuberculosis करता है. Increase protein, Mycobacterium tuberculosis करता है. इसे प्रैक्टिस करना, you have to practice. Chronic bacterial meningitis, increase protein, Mycobacterium tuberculosis करता है. सर इसी तरह Mycobacterium tuberculosis can affect spine also. Port spine, cot spine, right? Manifest with back pain, etc., etc., etc. There are many more sites involved, but these are the important signs for entrance exam. Right, sir. Pulmonary tuberculosis manifestation is evening rise of fever, cough for more than 2 weeks, and weight loss. Extrapulmonary lymph node is involved, lymphadenopathy, meninges are involved, neck rigidity, spine is involved, back pain. अभी कोई भी साइट हो सर, when site differs, manifestation differs. साइट डिफर हो जाएगा तो मैनिफेस्टेशन डिफर हो जाएगा, बट लैब डायग्नोसिस ट्रीटमेंट सेम ही रहेगा सर, क्योंकि बैक्टीरिया सेम है सर. व्हेन बैक्टीरिया इज सेम, लैब डायग्नोसिस ट्रीटमेंट विल रिमेन सेम. How will you lab diagnose Mycobacterium tuberculosis? That too I have already discussed in chronic bacterial meningitis. First step is acid fast staining, confirmatory test is CBNAT. इतना ही याद रखना है सर. First step is, see how easy we have made it. Sir, first step is acid fast stain, confirmatory step is CBNAT. Students बोलते हैं सर LJ culture media, Mycobacterium tuberculosis. Yes, कर सकते हैं, we can grow on LJ culture media. Guidelines बोलता है not preferred, LJ culture media not preferred. तो भूल जाओ, you have to forget about LJ culture media because guidelines they don't use it. क्यों सर? Because Mycobacterium tuberculosis is a slow grower. Slow grower मतलब सर, today you will put the sputum sample on LJ culture media. After 1.5 to 2 months Mycobacterium tuberculosis will grow. 2 महीने बाद grow होगा. After 2 months you will see, oh, Mycobacterium tuberculosis is growing. You took the Mycobacterium tuberculosis, you confirmed it is Mycobacterium tuberculosis, you are happy that you have identified Mycobacterium tuberculosis. When you see patient is already dead, है ना, 2 months से आप वेट कर रहे हो ग्रो होने का, Mycobacterium tuberculosis ग्रो हो गया, you have identified patient is dead, है ना. Our purpose is not to grow and identify Mycobacterium tuberculosis. Our purpose is to save the patient. याद रखना है, purpose नहीं भूलना है, right? Why I am telling you this is, when students are revising the notes, right, purpose भूल जाते हैं. Why they are revising the notes, right? Why are you revising the notes? To answer the questions when questions come from those topics. But students will forget this. Students will forget this. अभी स्टूडेंट्स को क्या है, रिवीजन खत्म होना है, खत्म हो गया है, खत्म हो गया सर, रिवीजन डन सर, डन सर, ओवर सर. कैन आई गिव द क्वेश्चंस, कैन यू आंसर? नो सर, नो सर, नो सर. इफ यू रिवाइज लाइक दिस, व्हाट इज द यूज? रिवाइज भी हो गया सर, मगअप भी हो गया सर, आंसर नहीं होगा सर. पर्पस वाज टू आंसर. व्हाई आर यू रिवाइजिंग? व्हाई आर यू मगिंग इट अप? व्हाई आर यू रिवाइजिंग? व्हाई आर यू टू आंसर? राइट, यू नो, दिस इज व्हाट योर सिचुएशन इज. If I tell you, take this subject pathology, take this subject pathology, revise, I will give you 3 days. After 3 days, हो गया? Yes sir, done sir. Right? Can you answer? No sir. Then what have you revised? Right? Your purpose was not to finish the revision. Your purpose was not to mug up the pathology. Yes, you have to finish. Yes, you have to mug up pathology. But the purpose was to answer the questions when the questions come from those topics. इसके लिए what I'm trying to tell is, while reading, your aim should be, I have to answer the questions. When your aim is to answer the questions, You will put efforts to understand the topic. When you understand the topic, then only you can answer the questions. If you mug up the topic, difficult to answer the questions. चलो anyways, we हम focus करते हैं ना, हमें important खत्म करना है, time हो रहा है, time is, we are running out of time, we have to finish, right? Important topics. Sir, mycobacterium tuberculosis means only two things you have to remember. First step is acid fast stain. Confirmatory test is CB-NAT. LJ culture is not preferred because it is a slow grower. But sir, Monto test, tuberculin test, IGRA means interferon gamma release से भूल जाना है, सब कुछ भूल जाना है. Only two tests. I told you mycobacterium tuberculosis means only two tests. First test acid fast stain, confirmatory test CB-NAT. सर Monto test IGRA कहाँ पे यूज करना है? Monto test and IGRA यूज फॉर द लैब डायग्नोसिस ऑफ latent tuberculosis. ये वर्ड याद रखना है, latent means asymptomatic tuberculosis. Symptoms जब नहीं होते हैं, that asymptomatic tuberculosis, then we have to use Monto test and IGRA for diagnosis. जब symptoms होते हैं, when symptoms are there, you should not use Monto test and IGRA, right? You have to use only two, sir, acid fast stain and CB-NAT, and LJ culture not preferred because it is a slow grower. समझ में आया? मजा आ रहा है ना माइक्रोबायोलॉजी पढ़ने में? कभी सोचा कि माइक्रोबायोलॉजी पढ़ने में भी मजा आएगा, राइट? समझने पे, कोई भी सब्जेक्ट पढ़ने पे मजा आएगा. समझकर पढ़ोगे, कोई भी सब्जेक्ट पढ़ने से मजा आएगा, क्योंकि आंसर होगा. समझकर पढ़ोगे तो क्या होगा? आंसर होगा. चलो सर, अभी ट्रीटमेंट, पल्मोनरी ट्यूबरकुलोसिस का ट्रीटमेंट. विल टॉक अबाउट पल्मोनरी ट्यूबरकुलोसिस. 2HRZD 4HRE, 2HRZD 4HRE 6 मंथ्स का ट्रीटमेंट है. अभी नया ट्रीटमेंट आया, WHO का न्यू ट्रीटमेंट, 2HPZM 2HPM 2HPZM 2HPM. चेंजेस क्या हुआ है सर? फर्स्ट चेंजेस, 6 मंथ्स का ट्रीटमेंट हो गया है 4 मंथ्स. 6 मंथ्स का ट्रीटमेंट हो गया है 4 मंथ्स. 2HPZM 2HPM. सेकंड, R is replaced with P. R means rifampicin. P means rifapentin. Rifampicin is replaced with rifapentin, right? E is replaced with M. E means ethambutol is replaced with M means moxifloxacin. So 3 changes, sir. Rifampicin replaced with rifapentin, ethambutol replaced with moxifloxacin, and 6 months का treatment हो गया 4 months, and this is for pulmonary tuberculosis. But guidelines is not saying कि you have to use new treatment. Guidelines is saying new treatment can be used. मतलब old treatment, new treatment, anyone, but both can be used. ऐसा नहीं कि old treatment चला गया, right? In India we are still using the old treatment. Sir, India में NTEP, NT means National Tuberculosis Elimination Program, clearly said use old treatment. क्योंकि new treatment is not available, it is still in the, you can say, to adapt we require more time. It has to be tested in a lot of in a large group of population. तो NTEP बोलता है अभी HRZD HRE use करना है. But in exam, if you get new treatment, HPZM HPM, WHO say use new treatment, so you can answer new treatment. Sir, you get tuberculosis, you know, you have clinical manifestations, you have lab diagnosis. Sir, lab diagnosis, you should not get confused. Mycobacterium tuberculosis, only two things. First step is acid fast stain, confirmatory test is CB-NAT, LJ culture is not preferred. फिर Monto test and IGRA is used for latent tuberculosis, जो asymptomatic tuberculosis होता है. Treatment 2HRZD 4HRE, नया treatment 2HPZM 2HPM. Right, sir, clinical diagnosis, lab diagnosis, treatment. मजा आया ना? इतने में खत्म नहीं होगा. Now we are not at over with tuberculosis. Tuberculosis is very important, right? Depth में जाना है और थोड़ा खोदना है, right? सर, एग्जामिनर पूछेगा रेसिस्टेंस. एग्जामिनर क्या पूछेगा सर? रेसिस्टेंस पूछेगा ट्यूबरक्लोसिस में. चलो, अब रेसिस्टेंस, साइड इफेक्ट्स ऑफ द ड्रग्स, बहुत सारी चीजें पूछेगा सर. फर्स्ट ऑफ ऑल, रेसिस्टेंट में सर एग्जामिनर पूछेगा विच आर द जीन्स, रेसिस्टेंट जीन्स इन्वॉल्व्ड. विच आर द रेसिस्टेंट जीन्स इन्वॉल्व्ड? सर वेरी सिंपल सर, isoniazid, INHA or cat G gene. Anyone, INHA, cat G gene is responsible for isoniazid resistance. Isoniazid resistance. Rifampicin RPOB gene for rifampicin resistance. Pyrazinamide TNCA gene. सर ethambutol EMB gene. याद रखना बहुत आसान है यार. हाउ सर? न्यूमोनिक कुछ नहीं बनाना है. आइसोनियाजिड, आई से स्टार्ट होता है, INHA, देखो RPOB, सोचो RPOB, आर से रिफैम्पिसिन, TNCA, P से पाइरिजिनामाइड, EMB मींस ethambutol. व्हेन यू सी द जीन यू नो द ड्रग. है ना, INHA आई से आइसोनियाजिड, RPO आर से रिफैम्पिसिन, PNCA पी से पाइरिजिनामाइड, EMB से सर फर्स्ट अल्फाबेट देखो यार, फर्स्ट अल्फाबेट मस्त है, जीन का फर्स्ट अल्फाबेट इज द नेम, इज द फर्स्ट अल्फाबेट ऑफ द ड्रग, तो इजी टू रिमेंबर, INHA आइसोनियाजिड, है ना, RPO रिफैम्पिसिन, हो गया बस, जीन्स याद रखना है, दे आस्क यू द रेसिस्टेंट जीन्स, देन साइड इफेक्ट्स पूछेंगे ड्रग्स के, सर रिमेंबर आइसोनियाजिड, इंपॉर्टेंट साइड इफेक्ट पेरिफेरल न्यूरोपैथी, पेरिफेरल न्यूरोपैथी, आइसोनियाजिड, देखो आइसोनियाजिड हिच है ना, यूजुअली स्टूडेंट्स निमोनिक क्या बनाते हैं, आप निमोनिक क्या बनाते हैं, आई नो यूर निमोनिक्स, ओके, निमोनिक क्या बनाते हैं, हेड से हैंड्स, हैंड्स मतलब पेरिफेरी, पेरिफेरल न्यूरोपैथी, दिस इज हाउ यू रिमेंबर। रिफैम्पिसिन देखो इजी सर, रिफैम्पिसिन आर से आर, रेड डिश ऑरेंज यूरिन, रिफैम्पिसिन का साइड इफेक्ट रेड डिश, रेड यूरिन, बस सिंपल याद रख लो, रेड यूरिन, रेड यूरिन, राइट, पाइरिजिनामाइड गाउट करेगा, यूरिक एसिड को इंक्रीज करेगा, गाउट, इंक्रीज इन यूरिक एसिड कॉजेस गाउट, मैनिफेस्ट विद आर्थराइटिस, सर इथाम्ब्यूटाल क्या करेगा, ऑप्टिक न्यूराइटिस, ऑप्टिक न्यूराइटिस, फर्स्ट फोर है, हेड से याद रख लो हैंड्स, हैंड्स मींस पेरिफेरल न्यूरोपैथी, इजी है ना फर्स्ट वाला, रिफैम्पिसिन आर से याद रख लो रेड यूरिन, दो तो याद हो गए, अभी दो पे फोकस करना है, पाइरिजिनामाइड एंड इथाम्ब्यूटाल, पाइरिजिनामाइड गाउट, इथाम्ब्यूटाल ऑप्टिक न्यूराइटिस, एग्जामिनर का फेवरेट है इथाम्ब्यूटाल ना, मल्टीपल टाइम पूछा हुआ है इथाम्ब्यूटाल ऑप्टिक न्यूराइटिस, सर जीन्स हो गए, साइड इफेक्ट्स हो गया, साइड इफेक्ट्स हो गए, प्रेगनेंसी में विच एंटी ट्यूबरकुलर ड्रग्स आर कॉन्ट्राइंडिकेटेड, ये भी पूछेगा, वेरी इंपॉर्टेंट, प्रेगनेंसी में कॉन्ट्राइंडिकेटेड है अमीनो ग्लाइकोसाइड लाइक अमिक एसिड, क्यों, ओटोटॉक्सिसिटी करेगा, ईयर टॉक्सिसिटी, तो प्रेगनेंसी में अवॉइड अमीनो ग्लाइकोसाइड्स लाइक अमिक एसिड, ये भी पूछेगा, फिर व्हाट टाइप ऑफ रेसिस्टेंस यू सी पूछेगा, माइकोबैक्टीरियम ट्यूबरकुलोसिस, आपको बोलना पड़ेगा मोनो ड्रग रेसिस्टेंट, मोनो मींस वन ड्रग, मोनो मींस वन ड्रग, मोनो ड्रग रेसिस्टेंस, H resistance or R resistance, isoniazid resistance or rifampicin resistance, MDR means multi drug resistance, means two drugs, H and R, isoniazid rifampicin, H and R, दो भी resistant तो multi drug, pre-XDR means pre-extensive drug resistance, means three drugs, कौन से three drugs, H, R, fluoroquinolones, देखो one by one you have to add, right sir, where can we get the PDF, right, I will share you the QR code, WhatsApp QR code, at the end you scan the code, you join the WhatsApp group, you will get the PDF, you will get the PDF, right, that is our the future discussion group, that is our future discussion group, okay, DBMCI ka future discussion group, okay, you will get the PDF, you just listen to the class, try to listen, try to understand, try to remember, listen, understand, put efforts to remember, ये तीन चीज करना है अभी साथ में, PDF आपको मिल जाए, राइट, लिखा हुआ अच्छा है ना, राइट, ब्यूटीफुली रिटन, प्रॉपरली अरेंज है, PDF चाहिए सर, है ना, चलो सर, प्री XDR प्री एक्सटेंसिव ड्रग रेसिस्टेंस, देखो एक एक ड्रग बढ़ाना है, मोनो ड्रग रेसिस्टेंस एक, H और R, मल्टी ड्रग दोनों H एंड R, प्री XDR तीन ड्रग H R, फ्लूरोक्विनोलोन्स, फ्लूरोक्विनोलोन्स मतलब लीवोफ्लॉक्सासिन, XDR एक्सटेंसिव ड्रग रेसिस्टेंट, एक्सटेंसिव ड्रग रेसिस्टेंट फोर ड्रग्स, विच आर द फोर ड्रग्स, H R फ्लूरोक्विनोलोन्स, either bidaquilin or linezolid, either bidaquilin or linezolid, चार ड्रग्स, एक ड्रग रेसिस्टेंट तो मोनो, दो ड्रग तो मल्टी ड्रग, तीन ड्रग तो प्री XDR प्री एक्सटेंसिव ड्रग रेसिस्टेंट, राइट, प्री एक्सटेंसिव ड्रग रेसिस्टेंट, चार हो गए तो XDR, चार हो गए तो XDR, और चौथा कौन सा है सर, पहला कौन सा है सर H, दूसरा R, तीसरा फ्लूरोक्विनोलोन, चौथा बिडाक्विलिन और लिनेजोलिड, चार ड्रग याद रख लो, पहला H, दूसरा R, तीसरा फ्लूरोक्विनोलोन, चौथा बिडाक्विलिन और लिनेजोलिड, याद रख लो, हो गया सर, इजी टू आंसर, ए वेरी हाई यील्डिंग स्लाइड, आई कैन चैलेंज यू, राइट, आज तक जिंदगी में आप इस तरह से नहीं समझा होगा, राइट सर, ड्रग्स, देयर जीन्स, देयर साइड इफेक्ट्स, द रेसिस्टेंस, एंड विच ड्रग इज कॉन्ट्राइंडिकेटेड इन प्रेगनेंसी, एंड यहाँ पे देखो क्लिनिकल डायग्नोसिस, लैब डायग्नोसिस, ट्रीटमेंट, क्लिनिकली कैसे डायग्नोसिस करोगे, लैब में कैसे डायग्नोसिस करोगे, ट्रीटमेंट, not only pulmonary tuberculosis, extra pulmonary tuberculosis, not only diagnosis of symptomatic TB, even the diagnosis of latent TB, अब बोलो जो चाहिए बोलो, सब कुछ है, whatever you want everything is here, right, whatever you want everything is here, राइट. इफ रेसिस्टेंस व्हाट टू गिव सर, इफ रेसिस्टेंट व्हाट टू गिव सर, उसके लिए देयर आर अदर ड्रग्स है ना, बिडाक्विलिन बेस, दूसरा लियो अदर ड्रग्स है. द ट्रीटमेंट फॉर रेसिस्टेंट टीबी इज नॉट इंपॉर्टेंट. इट इज वेरी डिफिकल्ट, कॉम्प्लिकेटेड टू कॉम्प्लिकेट, इट इज वेरी कॉम्प्लिकेटेड एंड इट इज डिफिकल्ट टू रिमेंबर. उसको छोड़ देना है. देखो इतना पढ़ लो टीबी, वेरी इंपॉर्टेंट. देखो कितना कंसाइज्ड कंटेंट है, राइट, सिंपल, 2 स्लाइड में खत्म. ये पूरा एक पेज है, ये आधा पेज, ये आधा पेज, 1 पेज में ट्यूबरक्यूलोसिस, व्हाट एवर यू नीड एवरीथिंग इज देयर, इजी टू रीड, इजी टू रिवाइज. एक बार पढ़ के देखो, राइट. ये लो यार, माइकोबैक्टीरियम ट्यूबरक्लोसिस लो, 2 बार रिवाइज करो, राइट. आई कैन चैलेंज यू मैन, you will remember like cake walk easily without any difficulty, and when question comes you can answer like cake walk without any difficulty. सच में बता रहा हूं, राइट. एनीवेज सर, चलो कंटिन्यू करते हैं सर. सर गैस्ट्रोएंटेरिटिस, अभी बैक्टीरियल गैस्ट्रोएंटेरिटिस. सर व्हेन वी टॉक अबाउट बैक्टीरियल गैस्ट्रोएंटेरिटिस, देखो गैस्ट्रोएंटेरिटिस मतलब सर डायरिया या डिसेंट्री होगा, डायरिया होगा या डिसेंट्री होगा, है ना. पता है आपको, डायरिया मींस लूज स्टूल है, डिसेंट्री मींस लूज स्टूल के साथ ब्लड होगा तो हम वी से डिसेंट्री. इफ देयर इज ब्लड इन द लूज स्टूल, डिसेंट्री, राइट. अभी when we talk about bacterial gastroenteritis, when we talk about bacterial gastroenteritis, देखो preformed toxin, bacteria producing preformed toxin means these bacteria produces toxin in the contaminated food before they enter into our body. तो preformed, पहले ही फॉर्म हो गया टॉक्सिन. फिर पोस्ट फॉर्म्ड टॉक्सिन, राइट. देन वी हैव पोस्ट फॉर्म्ड टॉक्सिन. Post formed toxin means these bacteria, they won't produce toxin in the food. First they will enter, then they produce the toxin in our body. Sir, what if the toxin is preformed? पहले ही फॉर्म हो गया है. तो usually incubation period is short, less than 6 hours. Incubation period means to manifest with symptoms. Disease develop होने के लिए कम टाइम लगता है. Toxin is already formed, तो toxin will enter, it cause the disease, less than 6 hours. But there are few preformed toxins which may take more incubation period also, like Clostridium botulinum. एक काम करते हैं सर, इसको डिलीट कर देते हैं, उसको रखेंगे तो डिफिकल्ट है, वो इंपॉर्टेंट नहीं. हम बस इंक्यूबेशन पीरियड शॉर्ट होता है, लेस देन 6 आवर्स. 2 याद रखना है, स्टेफिलोकोकस ऑरियस, बैसिलस सीरियस. सर स्टेफिलोकोकस ऑरियस एंटीरोटॉक्सिन प्रोड्यूस करता है. एंटीरो मींस इंटेस्टाइनल टॉक्सिन, टॉक्सिन दैट अफेक्ट इंटेस्टाइन. मिल्क में होता है या मिल्क प्रोडक्ट में होता है, मिल्क या मिल्क प्रोडक्ट. मिल्क प्रोडक्ट मींस मिल्क से जो भी बनता है, राइट, घी, चीज, राइट, बटर, कर्ड, मिल्क प्रोडक्ट. सर बैसिलस सीरियस एमिटिक टॉक्सिन प्रोड्यूस करता है, एंड कहां पे प्रोड्यूस करता है? फ्राइड राइस, फ्राइड राइस. सर टुमारो व्हेन क्वेश्चन कम्स, इंक्यूबेशन पीरियड इज शॉर्ट मींस 6 आवर्स. खाना खाने के 6 घंटे में वॉमिटिंग हो गया, डायरिया हो गया, तो आपको बोला है प्री फॉर्म्ड टॉक्सिन है. 6 घंटे में हुआ है तो जल्दी हुआ है, जल्दी हुआ है तो प्री फॉर्म टॉक्सिन है. 2 पॉसिबिलिटी, स्टैफ ऑरियस एंड बैसिलस सीरियस. फूड देखना है, मिल्क पीने के बाद हुआ है तो स्टैफ ऑरियस, फ्राइड राइस खाने के बाद हुआ है तो बैसिलस सीरियस. हाउ इजी मैन, वेरी इंपॉर्टेंट, एग्जामिनर्स फेवरेट. 2 प्री फॉर्म्ड टॉक्सिन. अभी पोस्ट फॉर्म्ड टॉक्सिन की बात करते हैं. सर पोस्ट फॉर्म टॉक्सिन, आई वांट यू टू रिमेंबर 3. इकोलाई, शिगेल्ला, विब्रियो. प्री फॉर्म 2 है सर, स्टेफिलोकोकस, स्ट्रेप्टोकोकस. पोस्ट फॉर्म 3 याद, देखो बहुत सारे, देयर आर मेनी, वी आर रिमेंबरिंग इंपॉर्टेंट. आई एम नॉट रनिंग ओनली 3. E. coli, Shigella and Vibrio. Sir, E. coli में I want you to remember EHEC. What is EHEC? Enterohemorrhagic E. coli. Enterohemorrhagic E. coli. How will you identify this is enterohemorrhagic E. coli? Sir, enterohemorrhagic E. coli is sorbitol. याद रख लो, sorbitol non-ferment. Sorbitol non-fermenter. सॉर्बिटॉल को फर्मेंट नहीं करेगा. दूसरे इक्वलाई, रिमेनिंग इक्वलाई, दे फर्मेंट सॉर्बिटॉल. That's how I can identify enterohemorrhagic E. coli. It is a sorbitol non-ferment. नहीं करेगा सॉर्बिटॉल को फर्मेंट. सॉर्बिटॉल इज ए शुगर. अगर सॉर्बिटॉल फर्मेंट नहीं हुआ तो enterohemorrhagic E. coli है, बिकॉज ऑल अदर E. coli फर्मेंट सॉर्बिटॉल. एंड दिस enterohemorrhagic E. coli का एक सीरोटाइप है सर, 1 सीरोटाइप, वो 157H7 क्या है, ये सीरोटाइप है सर. Serotype. What does it do? This serotype produces a toxin, sir. The toxin is known as virocytotoxin, also known as Shiga-like toxin. Virocytotoxin है actual name, but इसका common name है Shiga-like toxin. Why it is known as Shiga-like toxin? Because it is like Shiga toxin produced by Shigella. right? Uska function, uska action, uska manifestation, everything is same. Like Shiga toxin, that's what is known as Shiga like toxin. So enterohemorrhagic E. coli serotype O157H7, which is a sorbitol non-fermenter, produces a toxin Shiga like toxin known as virocytotoxin, and Shigella producing Shiga toxin. They are post-form toxins. Post-form means the toxins are formed inside our body. Post-form toxins. इसी तरह से Vibrio cholerae. Sir, Vibrio cholerae produces cholera toxin. This is also a post-formed toxin. Three post-formed toxins. First you tell me the three post-formed toxins. Enterohemorrhagic E. coli, serotype O157H7, serotype O157H7, which is a sorbitol non-fermenter, produces Shiga-like toxin, which is known as virocytotoxin. Here Shigella, Shiga toxin, Vibrio cholerae, cholera toxin. Very easy. These are the three post-formed toxins formed inside our body, not outside our body. Outside form होगा तो pre-formed. Inside our body form होता है. जब inside our body form होता है तो time लगता है, right? It takes time. As it takes time, incubation period is more than 16 to 36 hours. Incubation period is more than 16 to. Preformed toxin का incubation period is less than 6 hours. मतलब when you eat the food within 6 hours you will get manifestations. Right? अभी Vibrio cholerae ना very important for entrance exam. You have to remember Vibrio cholerae produces cholera toxin, causes cholera. Cholera manifest with rice watery diarrhea. मतलब diarrhea दिखने में कैसे लगता है? दिखने में चावल की गंजी. Somebody's imagination. Rice watery diarrhea. Diarrhea look like rice and water. Diarrhea look like rice and water. Right. And sir, on microscope, देखो MCT का मतलब क्या है? Microscopy culture test. On microscopy, Vibrio is comma shape. Fish in stream means it is arranged in a line, looking like fishes are going in a line. That is fish in stream appearance. And you know the characteristic motility of Vibrio is darting motility. It shows darting motility. Comma shape, arranged in a line, look like fish in stream, darting motility. On Vagatsuma agar, देखो Vagatsuma agar is nothing but, in simple words, it is a blood agar. Vagatsuma agar is a special type of blood agar. On Vagatsuma agar, no Kanagawa phenomenon. String test is positive. Treatment is doxycycline. When you're discussing Vibrio cholerae, you have to discuss Vibrio parahemolyticus. Vibrio parahemolyticus shows Kanagawa phenomenon on Vagatsuma agar. That's how we can differentiate Vibrio cholerae and Vibrio parahemolyticus. Sir, Kanagawa phenomenon on Vagatsuma agar, positive for Vibrio parahemolyticus. Right. Otherwise, Kanagawa phenomenon is not seen with Vibrio cholerae. Otherwise, most of the things will remain same. Most of the things, not everything, most of the things will remain same. Right. So this is about the post-formed toxins. Sir, ये हो गया pre-formed toxins, Staph aureus and Bacillus cereus. ये हो गया post-formed toxin. किसी ने कहा सर क्लॉस्ट्रिडियम बोटुलियम फ्लैसिड पैरालिसिस करता है एसिटाइल कोलिन. हाँ करता है, हम पढ़ेंगे. लेकिन गैस्ट्रोएंटेरिटिस भी करता है, इंपॉर्टेंट नहीं, वो छोड़ दो. Right. Sir, two preformed toxin, Staph aureus enterotoxin, Bacillus cereus emetic toxin. Food important. Food is important. Incubation period is important. Then only you can answer the questions in the exam. Just mugging up at the name of the toxins you can't answer. So three post-formed toxins are EHEC, Shigella, Vibrio cholerae. And you should know Vibrio parahemolyticus shows Kanagawa phenomenon positive. Abhi last question which I want to discuss in bacterial gastrointestinal system is Salmonella, typhoid fever. Sir, Salmonella causes typhoid fever. Salmonella causes typhoid fever. Typhoid fever क्या manifest करता है सर? Step ladder fever. Fever step ladder के जैसा होता है. Step ladder fever. Diarrhea, rose spots, relative bradycardia. अगर step ladder fever है, diarrhea है, rose spots means rashes है, relative bradycardia है. Salmonella, typhoid fever. How to diagnose? A very beautiful mnemonic ना, बासु, universal mnemonic. यूनिवर्सल निमोनिक में सारे दुनिया में यही निमोनिक यूज किया जाता है, बासु, है ना. बी फॉर ब्लड कल्चर, फर्स्ट वीक में ब्लड कल्चर करना है. ए फॉर एंटीबॉडी, सेकेंड वीक में एंटीबॉडी टेस्ट करना है, दैट इज वाइडॉल टेस्ट. एंटीबॉडी टेस्ट कैसे है? वाइडॉल. विच एंटीबॉडी? वो एंड एच. वो एंटीबॉडी more than or equal to 1:160 titer is positive. H antibody more than or equal to 1:320 is positive. Less than that, negative. Right? तो 160 320 होना चाहिए, वो 160, H डबल 320, पॉजिटिव होगा तो वाइडल टेस्ट पॉजिटिव, टाइफॉइड फीवर एंटीबॉडी डिटेक्टेड, वो एंड H एंटीबॉडी। सेकेंड वीक में करना है, फर्स्ट वीक में ब्लड कल्चर, सेकेंड वीक में एंटीबॉडी। सर व्हाई नॉट एंटीबॉडी इन फर्स्ट वीक? शुड नॉट डू एंटीबॉडी इन फर्स्ट वीक बिकॉज एंटीबॉडी peaks and antibodies detectable only in second week. Stool and urine culture, because stool and urine culture is done in third and fourth week, but it is usually done to detect salmonella carriers, ये याद रखना चाहिए, राइट। फॉर टाइफॉइड फीवर डायग्नोसिस, देखो टाइफॉइड फीवर डायग्नोसिस के लिए वी यूज ब्लड कल्चर एंड वाइडॉल टेस्ट। फर्स्ट वीक में ब्लड कल्चर, सेकेंड वीक में वाइडॉल टेस्ट। साल्मोनेला कैरियर्स के लिए वी यूज स्टूल कल्चर एंड यूरिन कल्चर। स्टूल कल्चर थर्ड वीक, यूरिन कल्चर फोर्थ वीक। And once you have diagnosed, you have to treat. IV drug of choice is ceftriaxone, oral drug of choice is azithromycin. हो गया सर टाइफॉइड। What most commonly what they ask is first week में what do you prefer? Blood culture. Second week में Vidal. You should not forget this. First week में only blood culture, no Vidal. Second week में only Vidal, no blood culture. No blood culture. Ideal is bone marrow culture. Ideal is bone marrow culture. But that is difficult. Invasive procedure associated with complications. नहीं करेंगे. You just remember blood culture. First week blood culture, second week Vidal. Treatment is IV ceftriaxone, oral azithromycin. Sir, next question, sir. Genital ulcerative disease. Next topic है genital ulcerative disease. Genital ulcerative disease means sir genital ulcers. Genital ulcers होंगे तो genital ulcerative disease होगा. Four important bacteria. Sir, which are the four bacteria which causes genital ulcerative disease? Klebsiella granulomatis, Haemophilus ducreyi, Treponema pallidum and Chlamydia trachomatis. तो याद कैसे करना है सर? Our method, क्या method है सर? 2+2. ब्रेन को बर्डन रिड्यूस करना है। ब्रेन को बोलो पहले दो याद कर साले, क्या बोलो ब्रेन को पहले साले दो याद कर। क्लेप्सियल्ला ग्रैनुलोमैटिस एंड हीमोफिलस डुक्रेई, रिपीट करो। क्लेप्सियल्ला ग्रैनुलोमैटिस हीमोफिलस डुक्रेई, क्लेप्सियल्ला ग्रैनुलोमैटिस हीमोफिलस डुक्रेई। ब्रेन बोलेगा ठीक है, और कितना बोलेगा? फिर बोलो दो और याद करना है, कौन सा है? ट्रिपोनीमा पैलिडम एंड क्लमाइडिया ट्रैकोमैटिस। ट्रिपोनीमा पैलिडम क्लमाइडिया ट्रैकोमैटिस, ट्रिपोनी। Now you ask your brain all the four: Klebsiella granulomatis and Haemophilus ducreyi, Treponema pallidum and Chlamydia trachomatis. Repeatedly revise करना है। Sir, all of them they cause genital ulcerative disease, means ulcer in the genital area. Sir, genital ulcerative disease caused by Klebsiella granulomatis is known as granuloma inguinale. Disease का नाम क्या है? Granuloma inguinale, also known as donovanosis. Klebsiella granulomatis causes granuloma inguinale, also known as donovanosis. Disease का नाम है। Haemophilus ducreyi causes chancroid. The name of the disease is chancroid. Chancroid. Treponema pallidum causes syphilis. The name of the disease is syphilis. That everybody knows. Sir, Chlamydia trachomatis causes LGV. LGV means lymphogranuloma venerum. Lymphogranuloma venerum. Sir, four bacteria, four diseases, and they cause genital ulcer. How is the ulcer? सर अल्सर इज पेनलेस एक्सेप्ट इन हीमोफिलस डुक्रेई, पेनफुल। एक ही जगह पे अल्सर पेनफुल होता है, हीमोफिलस डुक्रेई, राइट। सर व्हाट आर दिस ब्यूबोस? ब्यूबोस मींस एनलार्ज लिम्फ नोड्स। ब्यूबोस मींस एनलार्ज लिम्फ नोड्स, लिम्फेडिनोपैथी, लिम्फेडिनोपैथी। सर क्लेप्सियला में सूडो ब्यूबोस होते हैं, हीमोफिलस में पेनफुल ब्यूबोस, ट्रिपोनिमा में पेनलेस ब्यूबोस, क्लमाइडिया में पेनफुल ब्यूबोस। सर दिस इज व्हाट यू नीड टू नो। ऐसे बोल तो दिया सर, याद कैसे? हाउ टू रिमेंबर सर? देखो की पॉइंट को हाईलाइट करना है। सूडो ब्यूबोस मींस फॉल्स ब्यूबोस। इफ यू सी सूडो ब्यूबोस, कंफर्म्ड क्लेप्सियल्ला ग्रैनुलोमैटिस, पहला वाला की पॉइंट। बोथ आर पेनफुल। बोथ आर पेनफुल मींस व्हाट सर? अल्सर इज आल्सो पेनफुल, ब्यूबोस आर आल्सो पेनफुल, लिम्फ नोड्स आर आल्सो पेनफुल, बोथ आर पेनफुल। सब लोग एक ही निमोनिक से याद करते हैं, हीमोफिलस डुक्रेई, है ना, क्रेई, क्राइंग, क्राइंग, रो रहा है। क्यों रो रहा है? पेनफुल है। क्या पेनफुल है? अल्सर इज ऑल्सो पेनफुल, लिम्फ नोड, बोथ आर, डोंट से अल्सर इज पेनफुल, बोथ आर पेनफुल, अल्सर एंड ब्यूबोस बोथ आर पेनफुल, बोथ आर पेनलेस, बोथ आर पेनलेस। यू नो यूनिवर्सल निमोनिक है, सब लोग ऐसे याद करते हैं, सिफिलेस। सिफिलिस को सिफिलेस बना देते हैं, सिफिलेस, शुगरलेस मत बोलो, पेनलेस। क्या पेनलेस है? बोथ आर पेनलेस। Once you remember pseudobubos, the first one Klebsiella, both are painful, Haemophilus ducreyi, chancroid, both are painless, Treponema pallidum, syphilis। जो बच गया वो क्लमाइडिया। No need to remember. Chlamydia में देखो, one is painless, one is painful. Ulcer is painless, lymph node is painful. नहीं याद रखना है. Why to remember? Pseudobuboes is not there, so I know it is not Klebsiella granulomatis. Both are not painful, so I know it is not Haemophilus ducrei. Both are not painless, so I know it is not syphilis. So obviously it should be last one, chlamydia, LGB. So this is how we have to remember, sir. Correct. And finally, sir, bacterial infectious diseases को wind up कर रहे हैं. Last topic is for bacterial infectious diseases, bacteria में. Toxin mediated diseases, inhibiting neurotransmitters. Toxin mediated diseases, inhibiting neurotransmitters. Neurotransmitter को inhibit करने के diseases. Sir, which are those? देखो, pharmacology में आपने पढ़ा होगा. We have two types of neurotransmitters: excitatory neurotransmitter, inhibitory neurotransmitters. Right. Sir, first we'll talk about inhibiting excitatory neurotransmitter like acetylcholine. Inhibiting excitatory neurotransmitter acetylcholine कौन सा है सर? Clostridium botulinum toxin. Sir, inhibiting inhibitory neurotransmitters like GABA and glycine, which sir? Clostridium tetani tetanus fast. Right. Examiner पूछेगा which toxin inhibits acetylcholine. आपको बोलेगा Clostridium botulinum toxin inhibits acetylcholine, which is the excitatory neurotransmitter. Examiner पूछेगा which toxin inhibits GABA and glycine. आपको बताना पड़ेगा Clostridium tetani producing tetanus phasmin toxin inhibits GABA and glycine. Simple. सिर्फ mechanism of action. Examiner का एक favorite चीज है ना, there is one favorite thing of examiner for FMGE, especially FMGE. What is that? Tetanus toxoid vaccine. बहुत important है सर. You can't afford to go to the exam without studying the tetanus toxoid toxin. First of all, देखो आपको पता होना चाहिए. So nowadays we are not taking TT, we are taking TD. TD means tetanus and diphtheria. Right? TT नहीं ले रहे हैं, अभी TD ले रहे हैं. Tetanus and diphtheria. Sir, full protection. You will get full protection when you take 3 doses. Full protection when you take 3 doses. 3 doses. Right? And we know we take more than 3 doses in the childhood. We take more than 3 doses in the childhood. So we are fully protected because we have taken more than 3 doses. Just consider we have not taken, childhood में we have not taken tetanus. 0. अभी मैं बड़ा हो चुका हूँ, adult हूँ मैं अभी. Sir, can I take vaccine now? Yes. How many? 3 doses. Because if you take 3 doses, then only you are fully protected. Sir, childhood में नहीं लिया, I have not taken. Now if I take, can I take 3 doses together? Not together. First dose you have to take. First dose is known as 0 dose. Then 1 month after first dose. Then 6 to 12 months after first dose. Right? 3 doses if you take, you are fully protected. Once you are fully protected, booster dose you have to take every 10 years for your entire life. समझ में आ रहा है? Booster dose you have to take every 10 years for your entire life. Every 10 years. Sir, first of all, if you have taken at least 3 doses in childhood, you are fully protected. Not taken, take 3 doses. 0, 1, 6 to 12 months. And get fully protected. Once you are fully protected, you have to take booster dose every 10 years. First, you have to understand this. समझ में आया? If you have understood this, अब आते हैं यहाँ पे. Right? पेशेंट को इंजुरी हुआ है, पेशेंट गॉट इंजुरी. अभी क्या देना है? टीडी देना है. पहली बात, देना है या नहीं देना, वेदर यू हैव टू गिव और वेदर नॉट टू गिव. एंड इफ यू हैव टू गिव, हाउ मेनी डोजेस टू गिव. राइट? फॉर दैट फर्स्ट यू हैव टू सी patient is fully protected or not. How will you come to know? Ask the patient, have you taken 3 doses? Have you taken 3 doses any time in your life? Patient बोलेगा, yes, I have taken 3 doses in my life. Taken 3 doses in my life. So fully protected. Yes. Now see the wound. Clean or dirty? Clean or dirty? Dirty means मिट्टी रहेगा. Dirt, soil, sand. Clean means clean, right? Just a scratch or an incision, clean wound. Dirty means crushed, road traffic accident हो गया, मिट्टी पूरी, dirty wound. Sir, more than 3 doses taken, मतलब fully protected, wound is clean or dirty. Sir, whether wound is clean or dirty, because patient is fully protected, vaccine नहीं चाहिए. No need to give vaccine. Right? But the cutoff time period is 10 years for clean wound, 5 years for dirty wound. Means Sir, I have taken TD, tetanus, 3 doses taken. The last dose is within 10 years, within 10 years of injury. So you are fully protected. No need to take anything, nothing. But sir, last dose taken 10 years back. 10 years back, though, you have to take one dose now. Because I told you, no, booster dose every 10 years. Booster dose every 10 years. No, because 10 years got over, you have to give the booster dose and you have to send. Within 10 years, no need to give the booster dose. But if the wound is dirty, this 10 years period is reduced to 5 years because dirty wound mein risk is more. So duration is reduced. Within 5 years, no need to give nothing. More than 5 years, give the booster dose. The booster dose I told you have to give every 10 years. Yes, you have to give every 10 years, but if the wound is dirty, even after 5 years, you have to give the booster dose. समझ में आया? इतना ही है. Wound is clean. Within 10 years, no need to give because patient is fully protected. 3 doses taken. Protected है, तो no need to give vaccine. But more than 10 years, give the booster dose. But in dirty wound, reduce that 10 years cutoff time to 5 years because wound is dirty, risk is more. Within 5 years, even if the wound is dirty, more than 3 doses taken, to fully protected, don't give anything. More than 5 years, to give one booster dose. Because when patient has already taken 3 doses in the life, हमें बस देखना है कि booster dose देना है या नहीं देना है. 10 years got over for clean wound, give the booster dose. 5 years got over for dirty wound, give the booster dose. This is what you have to remember. Any difficulty? But sir, what if the patient is not fully protected? What if the patient is not fully protected? Means less than 3 doses, not fully protected. Less than 3 doses, right? So ask the patient how many doses you have taken in your life. Patient बोलेगा 1 dose have taken. तो आपको remaining 2 doses दे दो. Don't give only booster dose. If patient has taken 1 dose, give the remaining 2 doses. Total 3 doses. आपको you have to make the patient fully protected at least now. Because patient has taken 1 dose. समझो patient has taken 1 dose 10 years back. It's okay. Now you can give the 2 booster doses. Total 3 होना चाहिए. Total should become 3. Patient has taken 2 doses earlier, give 1 dose. Patient has not taken any dose, give the 3 doses. So TD के remaining doses based on how many doses patient have taken earlier. Patient has not taken anything, you have to give 3 doses. Not on the same day. I know first dose 0, then after 1 month, then after 6 to 12 months 3 doses. Patient को आना है वापस. Right, patient not taken any dose, so give the 3 doses. Patient taken 2 doses, give the 1 dose. Patient taken 1 dose, give the 2 doses. Remaining doses. Right, if patient is not fully protected. Right, when the wound is clean, clean wound. What if the wound is dirty? If the wound is dirty, also you have to give the remaining doses, but you have to add immunoglobulin. Antibodies भी inject करना है. Sir, immunoglobulins is added when the wound is dirty and patient is not fully protected. Otherwise, we won't add immunoglobulins. Worst condition है ना, fully protected भी नहीं है, and wound is dirty. The chance of infection is very high. So along with the vaccine, inject immunoglobulin. Hope you have understood. ठीक है सर. When the question comes, आपको पहले देखना है patient is fully protected or not. Fully protected, right? तो wound देखना है, clean wound. More than 10 years, 1 dose. Dirty wound, more than 5 years, 1 dose. Otherwise, nothing. Sir, patient is not fully protected. तो आपको बोलना है remaining dose दे दो. लेकिन अगर wound dirty है, add immunoglobulin. So easy it is. अभी पेशेंट पूछेगा, एग्जामिनर बोला प्रेगनेंसी में क्या करोगे? सर, इन प्रेगनेंसी, फर्स्ट प्रेगनेंसी, इवन इफ पेशेंट हैज टेकन टीटी इन चाइल्डहुड, प्रेगनेंसी में हैव टू रिपीट हाउ मेनी डोजेस? 2 डोजेस 1 मंथ अपार्ट. प्रेगनेंसी में 2 डोजेस 1 मंथ अपार्ट. सर, सेकेंड प्रेगनेंसी, सर सेकेंड प्रेगनेंसीज में इफ फर्स्ट प्रेगनेंसी वाज विद इन 3 इयर्स, so first pregnancy maybe a patient has taken 2 doses, now give only 1 dose. First pregnancy was 3 years back, then give 2 doses. Simple cutoff time period is 3 years. For pregnancy में 2 doses. Second pregnancy onwards, within 3 years pregnancy occur 1 dose, more than 3 years pregnancy occurs 2 doses. This is the tetanus vaccination, such a simplified version, nowhere you get. Again you have to listen to this video, okay? 2 से 3 बार सुनो. कौन सा? Tetanus vaccine, very important, very much simplified, easy to answer. You will easily answer, and you will rock for sure. You will rock for sure. Very important, most common repeated in the entrance exam. Most common repeated in the entrance exam. Sir, in crush injury, IgG needed. This is the question. Because crush injury is dirty wound. You only tell IgG needed or not. If the wound is dirty, crush wound, and if patient is not taken 3 doses, then immunoglobulin required. If crush injury, patient has taken more than 3 doses, immunoglobulin not required. And within 5 years, crush injury, more than 3 doses taken, nothing. No vaccine, no immunoglobulin. देखो, it is not like crush injury में immunoglobulin देना है. Sir, along with crush injury means dirty wound. Dirty wound means, sir, you have to take more than 3 doses, less than 5 years, nothing to give even if the injury is crush injury. More than 5 years, only 1 dose of TD. Sir, crush injury हुआ है, 3 doses नहीं लिया है, not fully protected, then only you have to give immunoglobulin. Easily समझ में आया ना? चलो, so with that, okay, there is one more last question in bacterial infectious diseases. Last question. Zoonotic disease acquired from animals, which is that, sir, leptospirosis, also known as Weil's disease. Leptospirosis, also known as Weil's disease. ये zoonotic disease है. क्यों zoonotic है sir? Acquired from rat's urine. So zoonotic, acquired from animal. Microscopic agglutination test, MAT. Microscopic agglutination test, MAT, if you remember. Manifest with conjunctival suffusion, cough, muscle tenderness, hepatorenal syndrome. Drug of choice is doxycycline. Examiners का favorite है leptospira. Conjunctival suffusion, examiners favorite word. When you see conjunctival suffusion, diagnose leptospirosis, right? Test याद रखना है microscopic agglutination test. Treatment याद रखना है doxycycline. हो गया सर, done, simple, so easy. Conjunctival suffusion, leptospirosis, rat urine से acquire होता है. Test is microscopic agglutination test. Treatment is doxycycline. Sir, all the important top high yielding topics have delivered. Hope you enjoyed. Hope you're enjoying. So with that, moving on to fungal. अभी fungal का start करते हैं sir. Mycology, fungal infectious diseases. Sir, first important is candidiasis. You know candidiasis. Sir, clinical manifestation. Clinical manifestation. White color patches removed on rubbing. White color patches removed on rubbing. स्किन में होगा तो क्यूटेनियस कैंडिडियासिस, ओरल म्यूकस मेम्ब्रेन, ओरल कैंडिडियासिस, ईसोफेजियल म्यूकस मेम्ब्रेन, ईसोफेजियल कैंडिडियासिस, वेजिनल म्यूकस मेम्ब्रेन, वेजिनल कैंडिडियासिस. बट मैनिफेस्टेशन क्या है? व्हाइट कलर पैचेस रिमूव्ड ऑन रबिंग. ओके सर, लैब डायग्नोसिस. सर, कैंडिडा इज हैविंग ईस्ट सेल्स. ईस्ट सेल का मतलब क्या? ईस्ट सेल मींस राउंड सेल्स व्हिच डिवाइड्स बाय बडिंग ईस्ट सेल्स, एंड कैंडिडा इज हैविंग सूडो हाइफे. Sir, pseudo hyphae. If you see pseudo hyphae star mark, confirm it is candida. Only candida is having pseudo hyphae, false hyphae. Right. Then you have to remember 2 tests. See, pseudo hyphae, candida. Then you have to remember 2 tests. Which are the 2 tests? Germ tube test positive. It is candida albicans species, जो most common species. Examiner पूछेगा, how will you identify candida? आप बोलोगे pseudo hyphae. How will you identify candida albicans species? आप बोलोगे germ tube test positive. Examiner पूछेगा, how will you identify other species? आपको बोलना पड़ेगा chrome agar culture, right? Chrome agar culture, other species. Treatment oral fluconazole, topical clotrimazole. हो गया sir candida. How many times you have studied candidiasis? My question is, have you ever understood like this? If yes, you are doing great, you are on the right path. Continue the same. If no, you're doing wrong, change your path. Start learning, start understand. Candida मतलब immediately दिमाग में क्या आना है? Sir, once you hear candida, white color patches removed on rubbing, pseudo hyphae, confirmed candida, germ tube test, confirmed albicans species, chrome agar culture, other species. Treatment oral fluconazole, topical means ointment, clotrimazole. ऐसा आ जाना चाहिए. Candidiasis हो गया सर. Next, cryptococcosis. When I ask students cryptococcus causes what, students बोलते हैं cryptococcus causes meningitis. A very good man, right? आफ्टर माई क्लास डोंट से मेनिंजाइटिस, करता है मेनिंजाइटिस, पर आपको बोलना पड़ेगा न्यूमोनिया। मोस्ट कॉमन क्या है? न्यूमोनिया, लंग इन्फेक्शन। मोस्ट कॉमन इज न्यूमोनिया, लंग इन्फेक्शन, फिर करता है मेनिंजाइटिस, फिर करता है मेनिंजाइटिस, राइट। लेकिन अगर HIV पेशेंट है, CD4 काउंट 100 to 200 है, देन cryptococcus is the most common cause of meningitis. HIV, CD4 count is 100 to 200. Then cryptococcus causes meningitis in HIV patient. This is what we study. But non-HIV patient में, right, most common disease is pneumonia, not meningitis. In HIV patient, when CD4 count is 100 to 200, at that time meningitis is more common. Otherwise pneumonia क्या करता है? pneumonia, meningitis, दो disease याद रखना है. Cryptococcus is, what do you see? Yeast cells, right? Only yeast cells, only yeast cells, no hyphae, no pseudo hyphae. देखो कैंडिडा you see yeast cell and pseudo hyphae, but Cryptococcus only yeast cell. Yeast cell means budding yeast cells, right? Sir, how will you confirm it is Cryptococcus? How will you confirm it is Cryptococcus? Detect the capsule. Cryptococcus is the only capsulated fungus in entire. Very good, sir, thank you, sir. Hey, welcome guys. Sir, in entire mycology, among all the fungi, only Cryptococcus is having capsule. In entire mycology, among all the fungi, only Cryptococcus is having capsule. Only Cryptococcus. तो कैप्सूल बता दो, कंफर्म हो गया क्रिप्टोकोकस। एक ही फंगस के पास कैप्सूल होता है। सर कैसे बताएंगे उसके पास कैप्सूल है? हाउ कैन आई से इट इज हैविंग कैप्सूल? हाउ कैन आई से इट इज हैविंग कैप्सूल? lateral flow assay detects capsule, otherwise negative stain like India ink detects capsule. When I ask students, how will you detect capsule? Student बोलते हैं negative stain, India ink. Hey, you are right, but exam में you have to answer lateral flow assay. Lateral flow assay is preferred. If lateral flow assay is not there, then go for negative stain, India ink. Sir, capsule is detected, Cryptococcus is confirmed, अभी treat करना है, treat that. Sir, liposomal amphotericin B plus flucytosine for first 2 weeks. First 2 weeks you have to give 2 drugs. Liposomal amphotericin B plus flucytosine. After that, fluconazole for more than or equal to 8 weeks. Treatment is important. Done Cryptococcus. And you know, Cryptococcus is found in the soil contaminated with pigeon excreta. Wherever pigeon excreta ना, pigeon का shit होता है, shit, वहां पे Cryptococcus होने के chances ज्यादा होते हैं. Cryptococcus, right? The habitat of Cryptococcus is the soil with pigeon excreta. Why? Sir, pigeon excreta is rich in creatinine, and creatinine is a growth factor for Cryptococcus. That's why Cryptococcus is usually found in the soil contaminated with pigeon excreta. देखो, Cryptococcus means first आपको दिमाग में क्या आना है? Pigeon का shit आना है. What has to come to your brain? Shit of the pigeon. Cryptococcus is there, and it enters. What does it cause? Pneumonia, HIV, 100 to 200 CD4 count, meningitis. How will you confirm capsule? How will you demonstrate capsule? Lateral flow assay or negative stain. Treatment क्या करोगे सर? Liposomal amphotericin B plus flucytosine for first 2 weeks, fluconazole for next 8 weeks. सर कैंडिडा हो गया, Cryptococcus हो गया, next dermatophytes. Dermatophytes. Among dermatophytes, the most important for you is dermatophyte infection of, sir, dermatophyte infection of scalp. Dermatophyte infection of scalp is known as Tinea capitis. Tinea capitis. Sir, अभी dermatophyte infection हो गया scalp का. What is the manifestation? What is the manifestation? Sir, if Tinea capitis is Kerion. Kerion का मतलब क्या है? Skin of the scalp is involved. तो boggy lesion. Boggy lesion means annular irregular surface lesion. Annular means circular lesion with irregular surface. Boggy lesion. When skin of the scalp is involved. When hair follicle is involved, favus, cup like crust lesion. Crust बनेगा, crust cup के जैसा रहेगा. Ectothrix, outside of the hair is involved. Gray patch, inside the hair, endothrix, gray patch with black dots. Sir, any one manifestation. Tinea capitis में क्या होगा? Any one manifestation. Skin involve होगा तो भी से Kerion, Kerion होगा तो boggy lesion होगा, annular lesion with irregular surface. हेयर फॉलिकल इन्वॉल्व होगा तो भी से फेवस, फेवस होगा तो कप लाइक crust बनेंगे, known as scutula. Outside the hair is involved तो भी called as ectothrix, तो ग्रे पैच मैनिफेस्टेशन होगा, दिखेगा. Endothrix, inside the hair होगा तो ग्रे पैच with black dots. When you see this, diagnose Tinea capitis. Caused by which fungi? Dermatophyte group of fungi. Dermatophyte group means Trichophyton, Microsporum, Epidermophyton. These are the three fungi which causes dermatophytosis. That's why we call them as dermatophyte group of fungi. Actual name of the fungi is Trichophyton, Microsporum, Epidermophyte. Group का नाम है dermatophyte. Sir, how will you identify Trichophyton, Microsporum, Epidermophyton? Conidiospore को देखकर आइडेंटिफाई करना है. Conidiospore. सर वेयर इज द कोनिडियोस्पोर? देखो ये है कोनिडियोस्पोर को ना प्यार से कोनिडिया बुलाते हैं, प्यार से कोनिडिया बुलाते हैं. ठीक है, कोनिडिया देख के आइडेंटिफाई करना. सर पेंसिल शेप कोनिडिया, ट्राइकोफाइटॉन, बोट शेप कोनिडिया, बोट के जैसा दिख रहा है माइक्रोस्पोरम, क्लब शेप कोनिडिया. क्लब मींस एक तरफ ब्रॉड है और एक तरफ नैरो है, ब्रॉड एंड नैरो एंड. बोट शेप मींस बोथ द साइड pointed ends, both the side pointed end. Pencil means pencil के जैसे, long. Sir, pencil shape conidia. Yeah, you have to remember this, okay? Sir, pencil shape conidia, trichophyton, boat shape conidia, microsporum, club shape conidia, epidermophyton, identified. Right, once identified, you have to treat. Treatment is greasiofulvin. Treatment क्या है? Drug of choice, greasiofulvin. Apart from that, you have to remember वुड्स लैम्प एग्जामिनेशन में एप्पल ग्रीन कलर लाइट, वुड्स लैम्प एग्जामिनेशन में राइट दिस बैक्टीरिया शो एप्पल ग्रीन कलर लाइट. एयर परफोरेशन टेस्ट इज पॉजिटिव बाय ट्राइकोफाइटन मेंटेग्रोफाइट्स. रेड पिगमेंट इज प्रोड्यूस्ड बाय ट्राइकोफाइटन रूब्रम. ये इजी टू रिमेंबर. देखो रूब्रम प्रोड्यूसेस रेड पिगमेंट. ट्राइकोफाइटन मेंटेग्रोफाइट्स परफोरेट द हेयर. वुड्स लैम्प एग्जामिनेशन में ग्रीन कलर लाइट इज प्रोड्यूस्ड. Green color light is produced. Sir, if you have added the images, it would have been great. Okay, तो revision videos में है ना images. You keep the revision videos and you follow this. Okay. I could have added the images also, but it is difficult to cover in 1.5 hours. Okay, this is better. Right, chalo next. Sir, we have completed candidiasis, cryptococcosis and dermatophytes, tinea capitis. अभी हमें डिस्कस करना है subcutaneous fungal infections. We have to discuss subcutaneous fungal infections. Subcutaneous fungal infections. Sir, subcutaneous fungal infections में you have to remember 3: mycetoma, which is known as Madura foot; sporotrichosis, which is known as Rose Gardner's disease; chromoblastomycosis, which shows copper penny appearance, copper penny disease. Mycetoma, Madura foot, sporotrichosis, Rose Gardner's disease, chromoblastomycosis, copper penny disease. They affect subcutaneous tissue. Right? What are the manifestation? Subcutaneous nodules with discharging granules. Mycetoma. Subcutaneous nodules present in a line along the lymphatic. Sporotrichosis. Subcutaneous nodules with verrucous lesions. Verrucous lesions means cauliflower-like lesions. Gobi. Chromoblastomycosis. Mycetoma is caused by Madurella mycetomatis. Name of the fungus, Madurella mycetomatis, which produces, identified by seeing black color granules. Sporotrichosis is caused by Sporothrix schenki, which is identified by seeing asteroid body, means star-like body, star-like body. And sir, chromoblastomycosis is caused by Cladosporium, which produces copper penny bodies. बस हो गया सर. ट्रीटमेंट इज ओरल इट्रोकोनोजोल IV. ट्रीटमेंट उतना इंपॉर्टेंट नहीं है. राइट, यू शुड नो क्लिनिकली हाउ टू आइडेंटिफाई, लैब डायग्नोस्टिकली हाउ टू आइडेंटिफाई. राइट, फर्स्ट यू रिमेंबर द क्लिनिकल डायग्नोसिस. Subcutaneous nodules with discharging granules, mycetoma. Subcutaneous nodules along the lymphatics, sporotrichosis. Subcutaneous nodules with verrucous lesions, chromoblastomycosis. फिर fungus and identification point. Mycetoma is caused by Madurella mycetomatis, identified by seeing black color granules. Sporotrichosis is caused by Sporothrix schenki, identified by seeing asteroid body, means star-like body. Chromoblastomycosis caused by Cladosporium, identified by copper penny bodies. हो गया सर. Right. So next, histoplasmosis and pneumocystosis, two important fungal diseases. Right. हिस्टोप्लाज्मोसिस ऑल्सो नोन एज डार्लिंग्स डिसीज। अब किसकी डार्लिंग ये मत पूछो यार, एक आदमी का नाम है डार्लिंग, डार्लिंग डॉक्टर डार्लिंग। So histoplasmosis is also known as Darling's disease. It causes pneumonia associated with skin papules. Pneumonia associated with skin papules. Histoplasma is intracellular yeast because of which it is present within macrophage and it is having conidia surrounded by tubercles. It is having conidia surrounded by tubercles. And treatment is itraconazole and liposomal amphotericin. So treatment is not that important. What is important? Histoplasmosis is also known as Darling's disease. Okay, manifest with pneumonia and skin papules, mimicking tuberculosis. Tuberculosis जैसे लगेगा. Tuberculosis. Okay, sir. It is having yeast form. It is having yeast form. And it is having mold form, septate mold form. वो याद रखने की जरूरत नहीं है, but what you need to know is in the yeast form you can identify when you see yeast cells within macrophage. Yeast cells means round cells. If you see round cells, yeast cells within macrophage, histoplasma. Because histoplasma is the only intracellular fungus. If you see a fungus inside a cell, it is always histoplasm. And if you see conidia surrounded by tubercles, conidia surrounded by tubercles means, see these round shape are conidia and these projections are tubercles. Conidia surrounded by tubercles. These are hyphae. Sir, hyphae are mainly, sir, conidia surrounded by tubercles. Histoplasma. And conidia is important, okay? देखो पहले भी हमने पढ़ रखा है. What we have studied? Pencil shape conidia, trichophyton, boat shape conidia, microsporum, club shape conidia, epidermophyton. इसी तरह conidia surrounded by tubercles, histoplasma. Conidia surrounded by tubercles, histoplasma. Right, sir, very very important. क्या पॉइंट्स याद रखना है? Darling's disease, mimic tuberculosis, yeast form में सर yeast cell within macrophage, mold form में सर conidia surrounded by tubercles. If you remember, you can answer. Sir, last disease in mycology, other fungi में last important disease we are discussing, which is that sir pneumocystosis. Sir, pneumocystosis manifests with pneumonia caused by a fungus Pneumocystis jirovecii. Pneumocystis jirovecii causes pneumocystosis, manifests with pneumonia. लेकिन sir, how to identify? You just have to remember, if you see black color cyst on GMS staining, confirmed it is pneumocystis. Black color cyst on GMS. GMS means Gomori methanamine silver stain. Sir, how come we come to know it is GMS stain? देखो, black color cyst, green color background. Green color background. Always remember G for green. GMS staining, Gomori methanamine silver stain gives green color background. If you see black color cyst on green color background, identify pneumocystis, it is GMS stain and it is non-cultivable. You cannot grow on culture media. That's why to confirm by PCR. Treatment is cotrimoxazole. Sir, finally, only one thing is important, image. If you see this image, black color cyst in green color background, you have to identify pneumocystis jirovecii. So with that, these are the high yield topics, okay? And pneumocystis jirovecii causes only one disease, pneumonia. And you have to remember, it is the most common cause of pneumonia when CD4 count is less than 200. It is the most common cause of pneumonia when CD4 count is less than 200. ये भी key point है यार. So 2 key points you have to remember. Pneumonia when CD4 count is less than 200. Pneumocystis jirovecii. Black color cyst on GMS staining, pneumocystis jirovecii. Non-cultivable fungus, pneumocystis jirovecii. 3 points you have to remember. Sir, high yield topics from mycology is done. Bacterial infectious diseases, mycology, fungal infection, abhi virology. Sir, when we talk about viruses, high yield topics from virology, viruses. Sir, if you talk about viruses, right? If we talk about viruses, first important point, what is that? Inclusion bodies and Zang cells. First important point for entrance exam, inclusion bodies and Zang cells. Okay? There are many inclusion bodies, important are 4. Which are the 4 inclusion bodies? Sir, यहां पे देखो यार, HSV, HSV मीन्स herpes simplex virus. Lipschutz bodies are Cowdery type A inclusion bodies. Lipschutz bodies are Cowdery type A inclusion bodies, HSV. CMV में cytomegalovirus owl eye inclusion bodies है ना, वेरी इंपॉर्टेंट. रेबीज है, नेगरी बॉडीज, सबको पता है सर. येलो फीवर, टोरीज बॉडीज आर ऑल्सो नोन एज काउंसिलमन बॉडीज. Four important inclusion bodies. Sir, how to remember? I know difficult to remember. What to do then? You remember only two. Which are the two? Cytomegalovirus, owl inclusion bodies. Sir, yellow fever, Tories bodies. ये examiners के favorite है. Cytomegalovirus, owl eye inclusion bodies. Sir, yellow fever, Tories bodies. Easy to remember. And Zang cells. What are Zang cells? Sir, Zang cells are nothing but MNGs. MNGs का मतलब multinucleate giant cells. And don't ask me what is multinucleate giant cells. Multinucleate, multiple nucleate, giant, बड़े, bigger cells with multiple nuclear, multinucleate giant cells. These are known as Zang cells. If you see Zang cells, right? Zang cells are seen in Zang smear. Zang smear. If you see Zang cells are two viruses, HSV and VZV. HSV means herpes simplex virus. VZV means varicella zoster virus. Both are herpes viruses. You know, 8 herpes viruses होते हैं, 8 herpes virus. In that HSV means herpes simplex virus, VZV varicella zoster virus. These two viruses, they show Zang cells. So ये important है. First important point in viruses, inclusion bodies and Zang cells. Second important point, how to lab diagnose viruses. Second important point, how to lab diagnose viruses. ये तो बहुत difficult है. But if you see our first introductory session, right, I told you people that, right, viruses के लिए what do we prefer? Molecular or immunological? At least इतना तो पता होना चाहिए. What is preferred for viruses? Molecular or immunological method is preferred for viruses. So, sir, now we know that molecular or immunological method is preferred. Right? Sir, molecular method is PCR. Molecular method is PCR. Immunological method क्या है? Immunological method means antigen detection or antibody detection. So now to diagnose viruses, either I have to detect antigen or antibody or PCR. Anyone. Which one to prefer? इसके लिए एक ब्यूटीफुल हमने निमोनिक बनाया है बहुत मेहनत से. बहुत मेहनत से एक जबरदस्त निमोनिक बनाया है, वो है HAR. राइट, निमोनिक याद रख लो यार, HAR HPRJM. ओके, हाईलाइट करता हूं निमोनिक को सर. राइट, निमोनिक को हाईलाइट कर रहा हूं यार. HAR HPRJWM. राइट, HPRJWM. बस इजी है याद रखना, HAR HPRJWM. Others, if virus is coming under HAR, answer antigen. Virus is coming under HPRJWM, answer antibody. Virus others में आता है, answer PCR. हो गया सर. Any virus you can answer. Sir, what is HAR? What is HAR? H means hepatitis B, adeno and rota. इसे याद रखना. H means hepatitis B, ER means adeno and rota. These are the three viruses where antigen detection is preferred. It's not like antibody. ऐसा नहीं कि antibody you should not do, PCR you should not do. You can do antibody, you can do PCR. Preferred. Antigen को prefer करना है. HAR, hepatitis B, adeno and rota. Easy to remember. HPRJM का मतलब क्या है? Sir, in HPRJM, H means three viruses. Hepatitis, HIV, Hanta. Hepatitis, HIV, Hanta. ठीक है. EBV, CMV भी आता है, उसको छोड़ दो. Just remember three. Hepatitis, simplify कर रहे हैं. Hepatitis, HIV, Hanta. Which hepatitis? All hepatitis viruses except hepatitis B. क्योंकि hepatitis B cover हो गया, HAR में it is covered. Remaining hepatitis viruses, HIV and Hanta. Then PR, Parvo and Rubella. Parvo and Rubella. JWM, JE, West Nile and measles. ठीक है, बोलो यार फिर से. Sir, you have to remember three viruses, then two viruses, then three viruses. Hepatitis, HIV, Hanta, Parvo and Rubella. JE, West Nile and measles. How many viruses? 8 viruses. Antibody is preferred. So 3 viruses, HAR, antigen is preferred, 8 viruses, HPR, JWM, antibody is preferred, remaining viruses, PCR is preferred. Any virus you can answer. Right? ये है हमारे निमोनिक का मैजिक. You are not just mugging it up. Hey, any virus you can answer the lab diagnosis. Any virus. But remember, this mnemonic is used when duration from symptoms is not given. इसको highlight करना है. किसको highlight करना है? This mnemonic is used when duration from symptoms is not given. When duration from symptoms is not given. मतलब fever since 1 day, fever since 5 days, fever since 10 days नहीं दिया है. To see the virus. And if it is under HAR, तो answer antigen, HPR, JWM, answer antibody वरना बोल दो PCR. But sir, duration of symptoms दिया है. Duration of symptoms is given. Duration of symptoms is given. Can Ebola and Hanta be asked? Chances are there, less chances. Chances are there, less chances. Right? चलो, अभी आप ही बता दो मुझे. Ebola and Hanta. Ebola and Hanta, both of them they cause viral hemorrhagic fever. क्या करते हैं? Viral hemorrhagic fever means viral fever associated with hemorrhage. So you know the disease, what they cause? Viral hemorrhagic fever. Both of them, Ebola and Hanta. Now you tell me, how will you diagnose Ebola virus and Hanta virus? जल्दी से बोलो यार. By using the mnemonic HAR, HPR, JWM. I want the answers from you. I'm waiting for the answers. Right? So now simple, sir, you have to see, is Ebola and Hanta are under HAR? They are not under HAR, so antigen को हटा. Are they under HPR, JWM? No, sir, they are not under HPR, JWM. They are under others. How to diagnose? PCR. Simple, देखो कितना easy है. Treatment, Ebola and Hanta, no treatment. Ebola and Hanta, no treatment. Right? तो आपको disease पता है, viral hemorrhagic fever. Diagnosis पता है दोनों के लिए PCR. ट्रीटमेंट पता है, नो ट्रीटमेंट. नो ट्रीटमेंट. बस एक एक चीज एक्स्ट्रा याद रखना है. इबोला इज फिलामेंटस. इबोला कैसा था? लॉन्ग फिलामेंटस एंड इट इज अक्वायर्ड फ्रॉम बैट. इबोला इज फिलामेंटस अक्वायर्ड फ्रॉम बैट, फ्रूट बैट एंड हांटा वायरस इज अक्वायर्ड फ्रॉम रैट. ये भी मस्त है निमोनिक. इबोला इज अक्वायर्ड फ्रॉम बैट, हांटा वायरस इज अक्वायर्ड फ्रॉम रैट. And Ebola is filamentous. If you know these points, you can answer all the questions from Ebola and Hanta. You can answer all the questions from Ebola and Hanta. Simple here. Right? Both of them they cause viral hemorrhagic fever. Both of them are diagnosed by PCR. Both of them no treatment. Sub common features. Then differentiating points. Ebola is acquired from bat and it is filamentous. Hanta is acquired from rat and it is not filamentous. चलो सर अभी लैब डायग्नोसिस ऑफ वायरसेस यहाँ पे ध्यान देते हैं. Sir, when duration from symptoms not given, then you have to see the virus. HAR में है तो antigen, HPR, JWM answer antibody, others में है तो answer PCR. Sir, what if duration from symptoms is given? Duration from symptoms is given, तो cutoff duration is 1 week. Cutoff duration is 1 week. देखो, not exactly 1 week. I have written here approximately 1 week. Approximately 1 week. मतलब वो 5 days भी हो सकता है, 7 days, 6 days. Different for different viruses. देखो, when duration is given, cutoff duration is 1 week. Approximate cutoff duration is 1 week. More than 1 week, answer antibody detection. More than 1 week, answer antibody detection. Less than 1 week, answer virus detection. And how can you detect virus? PCR, antigen, and tissue culture. There are 3 methods to identify virus. Which one to prefer in exam? First, prefer PCR. PCR is not there in the option. Second, prefer antigen. Antigen is not there. Third, prefer tissue culture. Simple. So this is the right. This page we have covered lab diagnosis of all the viruses. Lab diagnosis of all the viruses we have covered in this page. Lab diagnosis of all the viruses we have covered in this page. Sir, very important thing is whether duration from symptoms is given or not. Sir, when duration from symptoms is not given, see the virus. Is it under HAR, HPR, JWM and answer the question. And if duration from symptoms is given, don't see the virus. See the duration and answer. More than 1 week, antibody detection for all viruses, right? And less than 1 week, PCR for all viruses. PCR is not there. Antigen for all viruses. Antigen is not there. Tissue culture for all viruses. If you follow this, 99% of the time your answer will be right. I'm not telling 100%. देखो थोड़ा, it will not fit 100%, but 99% your answer will be right, and 99% is a huge percentage. You should be satisfied with that percentage. So chalo, inclusion bodies are over, lab diagnosis is over. Abhi finally treatment. We'll talk about treatment. Sir, only 4 viruses have treatment. Sir, only 4 viruses have treatment. Sir, which are the 4 viruses having treatment? Hepatitis and herpes, HIV and influenza. Hepatitis and herpes, HIV and influenza. Only 4 viruses have treatment. Sir, what is the treatment for hepatitis virus? Sir, drug of choice for hepatitis virus is tenofovir. Hepatitis B, tenofovir. Hepatitis C, sofosbuvir plus velpatasvir. Hepatitis B, one drug, tenofovir. Drug of, there are other drugs also. Preferred drug is tenofovir. Hepatitis C, 2 drugs, sofosbuvir and velpatasvir. Herpes, acyclovir or ganciclovir. Acyclovir. देखो simple. अगर don't want to get confused. Sir, first 4 viruses acyclovir, next 4 viruses ganciclovir, because totally we have 8 herpes viruses. Sir, totally how many herpes viruses we have? 8. First 4 के लिए preferred is acyclovir, next 4 के लिए preferred is ganciclovir. HIV, TLD, tenofovir, lamivudine, dolutegravir, influenza, oseltamivir. 4 viruses have treatment. Very, very important. Most common repeated in the entrance exam. Only 4. Remaining viruses, no treatment. Only 4. Hepatitis B, tenofovir. Hepatitis C, sofosbuvir and velpatasvir. Herpes, first 4 acyclovir, next 4 ganciclovir. HIV, TLD and influenza, oseltamivir. बहुत easy है याद रख. सर लैब डायग्नोसिस तो आप बता ही दिए, ट्रीटमेंट भी आप बता दिए, अभी डिसीजेस बता दो, डन. सर फर्स्ट इंपॉर्टेंट डिसीज इन वायरसेस इज वायरल एनसेफेलाइटिस. फर्स्ट इंपॉर्टेंट डिसीज इज सर वायरल एनसेफेलाइटिस. राइट, देखो एनसेफेलाइटिस मींस ब्रेन इन्फेक्शन, एंड ब्रेन इन्फेक्शन का मैनिफेस्टेशन इज सीजर्स. इफ यू सी सीजर्स इन माइक्रोबायोलॉजी, डायग्नोज encephalitis. 6 important viruses causes encephalitis. Important as 6, not only 6. Which are the 6? HSV1, herpes simplex virus 1, JC virus means John Cunningham virus, JE virus means Japanese encephalitis virus, Nipah virus means Nipah virus, then measles virus and rabies virus. Measles virus and rabies virus. 6 important viruses. याद कैसे रखना है? When there are 6, remember 2. Right? Reduce करो burden with the key point, which is used by the examiner in the question to get the answer. Right? Sir, temporal lobe. Key point को मैं highlight करता हूँ. Okay, I will highlight the key point now. Everybody concentrate. Temporal lobe encephalitis. Temporal lobe encephalitis involving the temporal lobe, HSV1. White matter encephalitis involving the white matter of the brain, JC virus, John Cunningham virus. Basal ganglia encephalitis involving basal ganglia, most commonly in northern India, only in children, transmitted by the bite of Culex mosquito, JE virus, that is Japanese encephalitis virus. Fruit bat encephalitis transmitted by fruit bat, Nipah virus. Panencephalitis, SSPE, after 7 to 10 years of measles virus disease, measles virus. Sir, brainstem encephalitis transmitted by animal bite manifesting with hydrophobia, 100% mortality, rabies virus. 6 important viruses causing encephalitis. Chalo, everybody tell me with the key points. 2 plus 2 plus 2. मेरे ही ट्यून में बोलना है कि वही ट्यून दिमाग में आएगा. टेम्पोरल लोब एनसेफेलाइटिस, HSV1, व्हाइट मैटर एनसेफेलाइटिस, JC वायरस, जॉन कनिंघम वायरस. बेसल गैंग्लिया एनसेफेलाइटिस, मोस्ट कॉमनली seen in northern India, only in children, transmitted by Culex mosquito, JE virus. fruit bat encephalitis Nipah virus, and encephalitis SSP measles virus brainstem encephalitis transmitted by animal bite manifesting with hydrophobia with 100% mortality rabies virus. देखो ये key point है. So you are remembering in a way that it is getting answered. Otherwise, normally what I have seen, how students they remember. Sir, viral encephalitis. Okay, 6 viruses. Okay, which are the 6 viruses? HSV, JC, JE, Nipah, measles, rabies. कैसे याद रखना है? निमोनिक बना लो. ओके, निमोनिक बना लिया. वायरसेस याद हो गए. कंसिडर याद हो गए, याद हो गए नहीं. निमोनिक बना लिया, वायरसेस याद हो गए. But can you answer the questions in the exam? No, because you are just mugging up the names of the viruses. You don't know HSV involves temporal lobe, so you can't answer. You know JC involves white matter, you can't answer. You don't know JE involves basal ganglia, seen in northern India, only in children, transmitted by you can't answer. You don't know Nipah is transmitted by fruit bat. You don't know measles causes panic. You don't know rabies brainstem, so you can't answer. So rather than making mnemonic, divide them into 2, 2, 2. And remember with the key points. Temporal lobe encephalitis, HSV, 1 white matter encephalitis, JC virus, 2 हो गए सर. Next, basal ganglia encephalitis, northern India, children, Culex mosquito, JE virus, fruit bat, Nipah virus. Next two, sir. SSP, measles, brainstem encephalitis, animal bite, hydrophobia, 100% rabies. 3-4 बार याद रख लो, easy से याद हो जाएगा. You can easily remember. Viral encephalitis. Next, sir, before we proceed to next, very important examiner's favorite, prophylaxis of rabies. Sir, for prophylaxis of rabies, we use 3 measures. Which are the 3 measures? Wound care. We use 3 measures. Wound care. ARV. ARV means anti-rabies vaccine. RIG. Rabies immunoglobulin. 3 measures use करते हैं. Do we have to take all the 3 measures? Wound care, vaccine, immunoglobulin. All the 3 measures should be taken? Sir, that depends on the category of the wound. Sir, we classify the wound of animal bite into 3 categories. Which are the 3 categories? Category 1, category 2, category 3. Sir, category 1 wound means touching or feeding the animal. If you touch the animal, if you feed the animal, we consider it as category 1 wound. Wound care is enough. Wound care means wash the wound for 15 minutes with soap and water. Wound care. Apply antiseptics. Category 2 wound, minor scratches without oozing of blood. So category 2, minor scratch और blood ऐसे निकल के बाहर नहीं आ रहा है, बह नहीं रहा है, it is not flowing. So wash the wound and vaccine. Category 2 wound, multiple bites with oozing of blood. Category 3 wound, wound care, vaccine, immunoglobulin. Sir, very easy, sir. Category 1 wound, only 1 measure, wound care. Category 2 wound, 2 measures, wound care and vaccine. Category 3 wound, 3 measures, wound care, vaccine and immunoglobulin. Easy, sir. 1 के लिए 1, 2 के लिए 2, 3 के लिए all the 3 measures. बस याद रखना है, category 1 wound means touching or feeding the animal. Touching or feeding the animal means unvaccinated animal. वरना घर में पेट होता है, हमेशा टच करते हैं, तो हमेशा wound care नहीं करना है. Unvaccinated animal, touching and feeding, wound care, wash करना है 15 minutes with soap and water. Minor scratches without oozing, category 2 wound care और vaccine भी लेना है. Multiple bites with oozing of blood, wound care, vaccine और immunoglobulin भी लेना है. Simple. सर आपका DBMCI कलकत्ता में कब है क्लास? ईगरली वेटिंग सर. इफ फेस टू फेस क्लास में इसी तरह से पढ़ाएंगे, इससे अच्छा पढ़ाएंगे क्योंकि टाइम रहेगा, मजे करोगे यार, वेट करो, मजे करोगे, एंजॉय करोगे, चेयर से ना उठोगे, ये मेरा चैलेंज है. ठीक है, चलो सर अभी पता चल गया सर. सर नाउ wound care means wash the wound for 15 minutes. Immunoglobulin is immunoglobulin. Mainly vaccine ARV कितने डोज लेना है सर? सर इफ यू टॉक अबाउट वैक्सीन, देखो इफ यू टॉक अबाउट वैक्सीन, right, we are highlighting the vaccine. Why I am highlighting the vaccine? Because I told you people, wound care means very easy, sir. Wound care means wash the wound with soap and water for 15 minutes. Immunoglobulin means, right, inject the immunoglobulin surrounding the wound, and immunoglobulin is taken only in category 3 wound. देखो हमने लिखा है ना category 3 wound में immunoglobulin देना है. But vaccine, sir, vaccine, right, pre-exposure prophylaxis. Pre-exposure means before the dog bite. There are 5 doses. 1, 2, 3, 4, 5. 5 doses lena. You have to take 5 doses on 0, 3, 7, 14, 28 days. 5 doses lena. Intramuscularly. Intramuscularly. If you take intradermally. So intradermally you have to take two doses. Two doses. But you should not take any dose on 14th day. But small change. Intramuscularly 1 dose, 5 doses. Intradermally two doses. Every time two doses. But no dose on 14th day. अब इंट्राडर्मल दैट फॉर ए मोमेंट उसको राइट हाइड कर दो, छोड़ दो. यू रिमेंबर इंट्रामस्कुलर 5 doses 0, 3, 7, 14 and 28 5 doses. ओके सॉरी ये क्या है, पोस्ट एक्सपोजर प्रोफिलैक्सिस नॉट प्री, पोस्ट एक्सपोजर आफ्टर द डॉग बाइट. आफ्टर द डॉग बाइट 5 doses. सर प्री एक्सपोजर प्रोफिलैक्सिस बिफोर द डॉग बाइट. Right, so 3 doses. Which 3 doses? Alternate. 0 पे 1 dose, 3 पे no dose, 7 पे 1 dose, 14 पे no dose, 28 पे 1. Alternate, easy to remember. 3 doses. Sir, re-exposure prophylaxis. Re-exposure means not the second time dog bite. Sir, I've taken post-exposure prophylaxis or pre-exposure prophylaxis earlier. I have taken it. I got the dog bite now. Now we call it as re-exposure prophylaxis. Re-exposure means when you have already previously vaccinated. If you are previously vaccinated either with PEP or PrEP, previously vaccinated, so we call it as re-exposure prophylaxis. Now re-exposure prophylaxis is based on the months. Within 3 months you have taken the vaccine, so no need to take vaccine again. 3 months got over, more than 3 months, then you have to take vaccine and you have to take 2 doses. First 2 doses 0 and 3. First 2 doses 0 and 3. बस इतना ही है सर वैक्सीन schedule. Very easy man. Sir, do you remember post exposure means after the dog bite 5 doses. Before the dog bite 3 doses. Right? Re-exposure 2 doses. Re-exposure 2 doses. सर और इजी से समझाता हूं. डॉग बाइट हो गया, आई हैव नॉट टेकन द वैक्सीन अर्लियर, तो 5 doses. सर पहले 3 डोज ले चुका हूं मैं प्री एक्सपोजर प्रोफिलैक्सिस, डॉग बाइट हो गया 2 doses, टोटली 5. डॉग बाइट के बाद 5 ले लो, वरना बिफोर डॉग बाइट 3, आफ्टर डॉग बाइट 2, 5 ले लो. टोटली 5. राइट, बट इफ यू हैव टेकन 3 doses prior, when dog bite occurs within 3 months, so no need to take the 2 doses. After 3 months if dog bite occurs, then only you have to take 2 doses. वो एक condition है बस. Vaccine 3 months, within 3 months have taken, so no need to take vaccine again. 3 months got over and then dog bite occur, then you have to take 2 doses. Previously not taken तो 5 doses. देखो इतना सिंपल है यार. Ultimately आपको याद रखना है 5 doses. Sir, previous to the dog bite I have not taken, to take 5 doses. Previously I have taken 3 doses. Now 3 months got over, then got the dog bite, take another 2 doses. For 5 doses. Very simple. Any doubts? Chalo sir. Next topic in virology, high yield topic. So next high yield topic in virology is HHV8. HHV8 means, sir, HHV8 causes Kaposi sarcoma. HHV8 causes Kaposi sarcoma. You know, most commonly seen in HIV. You know, it is a vascular tumor, purplish red elevated lesion seen on the leg and oral cavity. Lab diagnosis biopsy and PCR for HHV8 viruses, chemo or radiotherapy. सर याद क्या रखना है, कापोसी सार्कोमा एक वैस्कुलर ट्यूमर है, ब्लड वेसल का ट्यूमर है, इसलिए रेड कलर होता है, लेग और ओरल कैविटी में दिखता है, मोस्ट कॉमनली सीन इन HIV. दिस इज व्हाट यू हैव टू रिमेंबर. सर नेक्स्ट ह्यूमन पेपिलोमा वायरस 6 and 11 serotype causes anogenital warts. Anogenital में warts करेंगे condyloma, it is known as condyloma acuminata. 16 and 18 serotypes causes oropharyngeal cancer and anogenital cancer. Genital cancers like penile carcinoma and cervical cancer. Penile cancer and cervical cancer. E6, E7 genes present in human papillomavirus causes cancer. We have a vaccine. Name of the vaccine is Gardasil 9 and it contains L1 antigen. What is important, sir? Everything is important, right? Human papillomavirus, Everything is important. Everything means which serotype causes anogenital ward 6 and 11. Which serotype causes cancer 16 and 18. Which are the cancers? Oropharyngeal anogenital cancers. Easy है ना? Oropharyngeal anogenital, ऊपर और नीचे. ऊपर भी नीचे भी. Oropharyngeal anogenital. Which are the genital cancers? Penile cancer, cervical cancer. Which genes causes cancers? E6, E7 genes causes cancer. Which is the vaccine? Gardasil 9. Which is the antigen present in the vaccine? L1 antigen. Everything is important. Everything is important. Right? Sir, parvovirus. Next important virus is parvovirus. Next important virus is parvovirus. Now, कोई पूछ रहा है क्या? Sir, is this enough? Right? For 10 questions out of 15 questions coming in FMGE. मतलब वो एक 2 hours के सेशन में पूरा आ जाएगा 10 क्वेश्चन आउट ऑफ 15. Very difficult to tell in 2 hours session. But yes, I can say numbers, it is very difficult to confirm. Maximum number of questions will come. High yield, very high yield. Maximum number of questions will come. Right? I will tell you, you will enjoy this session if you revise. If you watch this 1 or 2 times, if you revise, you will enjoy, you will answer maximum questions. इतना बोल सकते हो. Number difficult. 2 hours में क्या commit? 2 hours में कोई भी क्या commit कर सकता है यार? Difficult to commit. Anyways, sir, parvovirus. Sir, in children, it causes rashes on the cheeks, right? Look like somebody has slapped the baby, slap cheek appearance. Disease name is erythema infectosum, also known as fifth disease. In adults, it causes arthritis. In sickle cell anemia patient, it causes aplastic anemia. Easy na? Sickle cell anemia, aplastic anemia. Immunocompromised patient, it causes pure red cell aplasia, means loss of RBCs. Congenital infection, it causes non-immune fetal hydrops. There is a condition known as immune fetal hydrops. Immune fetal hydrops is seen in RH incompatibility. Sir, whatever it is. अभी 5 parvovirus बोलो यार. Parvovirus children में क्या करेगा? Rashes on the cheeks, slap cheek appearance. Adults, arthritis. Sickle cell anemia, parvovirus causes aplastic anemia. Immunocompromised patient, parvovirus causes pure red cell aplasia. Congenital infection, parvovirus causes non-immune fetal hydrops. Immune fetal hydrops कहाँ पे दिखेगा? RH incompatibility. Students always get confused non-immune and immune, and that's why I always tell students I for I. I for I means immune fetal hydrops is seen in incompatibility. RH incompatibility. If you remember, immune is seen in incompatibility, the non-immune fetal hydrops is seen in parvovirus, most commonly asked in the exam. So last high yield point in virology. Which is the last high yield point in virology? Sir, congenital infections. What is the universal mnemonic? Sir, universal mnemonic is torch. Right? अब अपडेट कर लेना है. Zip torch. Mnemonic क्या है? Zip TV torch. Right? नया mnemonic क्या है सर? Zip TV torch. हमारा mnemonic. Zip TV torch. Sir, what do you mean by Zip TV torch? ZI, right? ZI means Zika. P means parvo. Zip means Zika and parvo. TV means Treponema pallidum जो syphilis करता है. V means varicella zoster virus. टॉर्च तो आपको पता है, T for toxoplasma, वो for others. See, others को ही तो explain किया. Others में we are putting Zip TB. Others में we are putting Zip T. Right? R for rubella, C for cytomegalovirus, H for herpes. So everybody know torch में T for toxoplasma, R for rubella, C for cytomegalovirus, H for herpes. अब others में क्या आता है? Others में आपको याद रखना है Zip TB आएगा. Zip TB means Zika, parvo, Treponema pallidum, varicella zoster virus. Zip TB torch, light वाला torch. Zip TB torch. Right? ठीक है sir. What to remember? Hey, only the key point you have to remember. Right? What is the key point? Zika subcortical calcifications. Calcifications in the brain just below the cortex of the brain. Subcortical calcifications. ठीक है? Toxoplasma, diffuse calcification means calcifications in the brain which is diffusely spread in the entire brain, involving the entire brain. Periventricular calcifications, cytomegalovirus. So you have to remember calcifications in 3 places. Brain में calcifications, but what is the site? See, calcification is seen in brain, but which part of the brain? Right? Remember, subcortical calcification, just below the brain, Zika virus, entire brain, toxoplasma. Periventricular means surrounding the ventricles, cytomegalovirus. Sir, difficult to remember. At least remember one important. Periventricular calcifications. Calcifications in the brain surrounding the ventricle, cytomegalovirus. Never forget. Never forget. Okay, fine, sir. Next, sir. Next to both is here. Non-immune fetal hydrops, parvovirus, immune fetal hydrops, incompatibility. Hutchinson's teeth, Hutchinson's trad, syphilitic trad. Patent ductus arteriosus, rubella. Yes, sir. Patent ductus arteriosus, rubella. Vesicles, herpes. Sir, vesicles, herpes. हुई है यार, एक ही याद रखना है. Skin scars and short limbs, varicella zoster virus. Done. Easily you're remembering all the 8 important and manifestations. Right? Sir, Zika, subcortical calcifications. Toxoplasma, diffuse calcifications. Cytomegalovirus, periventricular calcifications. Not able to remember? Remember only one, periventricular calcification, cytomegalovirus. Remaining to you know, non-immune fetal hydrops, parvovirus, Hutchinson teeth, syphilitic trad. Vesicles means herpes, PDA, patent ductus arteriosus, rubella, skin scar and short limbs, VZV, varicella zoster virus. Once you know the manifestations, 8 important viruses causing congenital infection, which is the one most commonly causes congenital infection. Most common virus causing congenital infection. Yaad rakhna hai, very important. Most common is cytomegalovirus, least common is herpes virus. Herpes means, राइट, यहाँ पे हर्पीस को हटा के स्पेसिफिकली लिख देते हैं हर्पीस सिंप्लेक्स वायरस, HSV. मोस्ट कॉमन इज CMV, लीस्ट कॉमन इज HSV. मोस्ट कॉमन कंजेनिटल इन्फेक्शन cytomegalovirus, लीस्ट कॉमन इज herpes simplex virus. Though most common is cytomegalovirus, more teratogenic is rubella. Teratogenic means congenital malformations. Because cytomegalovirus is most common, but it won't cause congenital malformations. Congenital malformation is seen with rubella. Least teratogenic, again HSV. Least teratogenic HSV. देखो बहुत सिंपल है. Most common congenital infection फिक्स कर लो cytomegalovirus, but most common teratogenic is rubella. Least common whatever it is HSV. Least common whatever it is HSV. Sir, very beautiful, very important. Most common repeated in the entrance exam. So with that, completed high yield topics from virology. बैक्टीरियल इन्फेक्शियस डिसीज हो गया, फंगल हो गया, वायरल, अभी पैरासाइटिक. राइट, वी हैव टेकन अ लॉट ऑफ टाइम. पैरासाइटिक विल थोड़ा रश थ्रू कर देंगे, लेकिन मजा तो आया ना. चलो, पैरासाइटिक में सर वेरी इंपॉर्टेंट, मोस्ट कॉमन रिपीटेड इन FMGE केराटाइटिस. मोस्ट कॉमन रिपीटेड इन FMGE केराटाइटिस. सर केराटाइटिस मींस क्या है? कॉर्नियल अल्सर. विच पैरासाइट कॉजेस कॉर्नियल अल्सर? सर अकैंथमीबा कॉजेस कॉर्नियल अल्सर. फंगी आल्सो कॉजेस कॉर्नियल अल्सर. वायरसेस आल्सो कॉजेस कॉर्नियल अल्सर. Sir, which fungi? Sir, Fusarium fungus. Fusarium fungus. Sir, which virus? Herpes simplex virus. How to identify? How to identify? Sir, यहाँ पे हाईलाइट करता हूँ, देखो यार. Ring infiltrate. Corneal ulcer surrounded by a ring, a white color ring. Acanthamoeba. Satellite lesions with feathery margins. Satellite lesions with feathery margins, fungal ulcer. Branching ulcer, which is also known as dendritic ulcer, viral ulcer. Simple man. ये इंपॉर्टेंट है. कॉर्नियल अल्सर देखिए ना, रिंग इनफिल्ट्रेट, अकैंथमीबा, parasitic ulcer, satellite lesions with feathery margins, fungal ulcer, fusarium, branching or dendritic ulcer. Dendritic मतलब branching ulcer, herpes simplex virus. Very important. Very important. Right, second topic, sir. Non-acid fast protozoa causing gastroenteritis. Protozoa causing gastroenteritis, which are non-acid fast. Sir, why to tell non-acid fast? Because we have to discuss acid fast protozoa also causing gastroenteritis. पहले non-acid fast पढ़ लेते हैं. We have to discuss acid fast protozoals. First we'll discuss non-acid fast. Two important non-acid fast protozoa causing gastroenteritis, Entamoeba histolytica and Giardia. Entamoeba histolytica and Giardia. Two important non-acid fast protozoa causing gastroenteritis, Entamoeba histolytica and Giardia. क्या करते हैं? Gastroenteritis करते हैं. But how will you identify? Dysentery with flask shape ulcer, Entamoeba histolytica, diarrhea with Steatoria, Giardia. खत्म. ये होगा क्लिनिकल मैनिफेस्टेशन में आइडेंटिफिकेशन. लैब डायग्नोसिस, take the stool sample. What do you see? Sir, in the stool sample, what do I see? I see cyst and trophozoid. क्या दिखेगा? Cyst and trophozoid. How will you identify? Sir, cyst is round in shape having 4 nuclei. Giardia cyst is oval in shape having 4 nuclei. Right? So what is the difference? Shape. Sir, round shape 4 nuclei. Highlight करो, round shape 4 nuclei. Entamoeba histolytica, oval shape 4 nuclei. Giardia. Trophozoid. RBC in the trophozoid. Entamoeba histolytica. Sir, 8 flagella. Trophozoid with 8 flagella showing falling leaf motility. Sir, Giardia. Treatment. Sir, both of them treatment is metronidazole. Both of them treatment is metronidazole. But for asymptomatic Entamoeba histolytica, treatment is diloxanate furoate. Asymptomatic Entamoeba diloxanate. Oh, हो गया sir. Non-acid fast. Acid fast. Sir, there are 3 acid fast protozoa: Cryptosporidium, Cyclospora, Cystoisospora. बोलो यार प्यार से. क्रिप्टो, साइक्लो, सिस्टोआइसोस्पोरा बोलते हैं प्यार से. क्रिप्टो, साइक्लो, सिस्टोआइसोस्पोरा. तीनों एसिड फास्ट है. राइट. एसिड फास्ट है तो सर ऐसा इमेज दिखेगा ना, एसिड फास्ट सिस्ट, पिंक कलर इन ए ब्लू कलर बैकग्राउंड, तो एसिड फास्ट. हाउ विल यू आइडेंटिफाई? सर वो इंपॉर्टेंट है सर. हाउ टू आइडेंटिफाई? इमेज आएगा. इमेज सर राउंड इन शेप, स्मॉल इन साइज, 4 to 5 micron, क्रिप्टोस्पोरा. राउंड इन शेप, बिगर इन साइज, 8 to 10 micron. देखो डबल द साइज, 4 to 5, 8 to 10. साइक्लोस्पोरा. वोवल इन शेप, सिस्टोआइसोस्पोरा. सर ओनली वन थिंग दे आस्क, इमेजेस. ओनली वन थिंग दे आस्क, इमेजेस. इमेजेस. ठीक है. देखो राउंड शेप है तो साइज इंपॉर्टेंट है. राउंड शेप स्मॉल साइज क्रिप्टो, राउंड शेप बिग साइज साइक्लो, वोवल शेप सिस्टोआइसो. Finally, sir, blood and tissue protozoa. Right? Finally, blood and tissue protozoa. So, 3 important blood and tissue protozoa. Which are the 3 important blood and tissue protozoa? Sir, leishmania transmitted by sandfly. Sir, plasmodium transmitted by the bite of Anopheles mosquito. Toxoplasma transmitted by cat's feces. And lab diagnosis के लिए we do peripheral blood smear because they are present in blood. Because they are present in blood. Because they are present in blood. Okay. Okay. बहुत सारे क्वेश्चंस आ रहे हैं सर. माइक्रोसेफेली कहाँ गया सर? सेबिन कहाँ सर? साक कहाँ सर? वैक्सीन कहाँ सर? यार मैं माइक्रोबायोलॉजी फेस टू फेस क्लास में 5 days पढ़ाता हूँ. यहाँ पे 2 घंटा पढ़ा रहे हैं. 2 घंटे में सब कहाँ से आएगा? वही तो बताया स्टार्टिंग में. वही तो आप लोग स्टार्टिंग से नहीं हो यार. यू आर नॉट देयर फ्रॉम द बिगिनिंग. वी आर फोकसिंग ऑन हाई यील्ड पॉइंट्स. 2 hours का सेशन है. राइट. ऑब्वियसली व्हाट इज कवर्ड इज लेस, व्हाट इज लेफ्ट इज मोर. ट्राई टू अंडरस्टैंड. Right? Rather than asking this is where, what is this, this is left, that is left, focus on what is covered. This is very high yield, maximum questions answer होंगे. Right? 2 hour का सेशन है, सब कवर नहीं होगा, पहले वो समझ लो यार. राइट. ठीक है, चलो कंटिन्यू करो सर. सर 3 important blood and tissue protozoa. Leishmania transmitted by the bite of sand fly. Important है sand fly, leishmania. Plasmodium transmitted by the bite of Anopheles mosquito. Toxoplasma transmitted by the cat's feces. Diagnosis by peripheral blood smear. Peripheral blood smear. चलो लेट्स डिस्कस वन बाय वन. पहले लीशमेनिया. सर लीशमेनिया एफएमजी एग्जामिनर का पता नहीं यार. लीशमेनिया पड़ोसी है, बट वेरी फेवरेट, एग्जामिनर का फेवरेट है. पड़ोसी है, पड़ोसन. लीशमेनिया पड़ोसन. एग्जामिनर की पड़ोसन है लीशमेनिया. ठीक है. हमें पता है लीशमेनिया इज ट्रांसमिटेड बाय सैंड फ्लाई. सैंड फ्लाई. एंड लीशमेनिया के पास क्या होता है सर? काइनेटोप्लास्ट एंड RK39 एंटीजन. इट इज प्रेजेंट विद इन मैक्रोफेज. ये स्टार मार्क डालो यार, नेवर फॉरगेट. Leishmania means these 4 points mandatory. Leishmania is present in sandfly, right? Leishmania is present in sandfly. Okay, live 360. हाँ यार, live 360 या फेस टू फेस क्लास ना, live 360 में 9 days लेता हूँ. 9 days में हाफ ऑफ डे, तो ओवरऑल 5 days ही होता है. माई क्लास इज ऑफ 5 days. चलो भी आ जाओ यार. Leishmania is present in sandfly. Leishmania is having kinetoplast. Leishmania is having RK39 antigen. Leishmania is present in macrophage. Most commonly asked in the exam, these 4 key points. It causes leishmaniasis, which is also known as Kala Azar, most commonly seen in Bihar, manifest with hepatosplenomegaly and hyperpigmentation. पेरिफेरल ब्लड स्मीयर में क्या दिखेगा सर? जो हमने डिस्कस किया था, RK39 एंटीजन, काइनेटोप्लास्ट, मैक्रोफेज के अंदर दिखेगा. ट्रीटमेंट क्या है? ओरल मिल्टेफोसिन, IV लाइपोसोमल एम्फोटेरिसिन भी. So these are the important points. Mug up the points. Very important. Leishmania, most common repeated, examiner's favorite. Plasmodium, next favorite. Next favorite. Very, very important. Right. Very, very. Sir, blood and tissue protozoa ना, तीनों examiner के पड़ोसन है. तीनों entire blood and tissue protozoa is important. Okay, Plasmodium. Plasmodium is transmitted by Anopheles mosquito. Plasmodium causes malaria, fever, chills, and hepatosplenomegaly. We have 2 important species of Plasmodium, Falciparum and Vivax. How will you differentiate? Sir, in peripheral blood smear, what do we see? Sir, in peripheral blood smear, we see ring forms, schizont, and gametocyte. 3 चीजें दिखते हैं. Ring form. Sir, ring form में sir, single ring form is seen in Falciparum and also Vivax. But multiple ring form only in Falciparum. Schizont is seen only in Vivax. Schizont is not seen in Falciparum because it is attached to capillary endothelium. That's why it is not seen. Gametocyte banana shape, Falciparum. Banana shape, Falciparum. Sir, key points क्या है? Sir, for Falciparum you have to remember, multiple ring forms and banana shaped gametocyte. Multiple ring forms. 2 key point याद रखना है. Falciparum, multiple ring forms, banana shaped gametocyte, and for Vivax you just have to remember schizont is seen. After that, antigens be important है. PLDH antigen. PLDH means Plasmodium LDH is seen in both Falciparum and Vivax. HRP2 antigen means histidine rich protein to antigen only in Falciparum. So 3 key points for Falciparum: multiple ring forms, banana shaped gametocyte, HRP2 antigen. 1 key point for Vivax, schizont. ठीक है. अभी ट्रीटमेंट, एग्जामिनर का फेवरेट है ट्रीटमेंट, राइट सर. इफ आई टॉक अबाउट द ट्रीटमेंट ऑफ both Falciparum and Vivax, treatment of both Falciparum and Vivax. देखो, फर्स्ट पॉइंट यू शुड हैव एन आइडिया. सर, Falciparum is more resistant. We see recrudescence, and Plasmodium Vivax is less resistance, and we see relapse. ट्रीटमेंट क्या है सर? सर, ट्रीटमेंट को मगअप करना है. याद करने का तरीका बताने के लिए टाइम नहीं है. एंड इफ यू हैव एनी निमोनिक यू कैन गो अहेड विद दैट. सर, Falciparum treatment is artesunate pyrimidamine with sulfadoxine and primaquine. It is used in entire India except in Northeast India. In Northeast India, artesunate is replaced with artemether. Pyrimidamine and sulfadoxine replaced with lumefantrine, and primaquine is used as Primac. Northeast India में treatment different है. Northeast India मतलब असम, मेघालय, त्रिपुरा, मिजोरम, नागालैंड. यहाँ पे ट्रीटमेंट क्या है? आर्टीमीथर, ल्यूमेफेंट्रिन, प्राइमाक. 3 drugs. Remaining India, artesunate, pyrimidamine with sulfadoxine, Primac. So in entire India 3 drugs अलग है. In Northeast India 3 drugs अलग है. In pregnancy artesunate, only 1 drug, artesunate. देखो, पहले ना फर्स्ट ट्राइमेस्टर में क्विनिन, सेकेंड एंड थर्ड ट्राइमेस्टर में artesunate, ऐसा पढ़ाई करते थे. Now WHO say all the 3 trimester artesunate. Northeast India, artemether. So this is the treatment. Right. Pregnancy में only artesunate. Why only artesunate? Because remaining drugs are contraindicated. Why they are contraindicated? Pyrimidamine decreases folic acid, causes neural tube defects. Sulfa drugs and primaquine causes hemolysis. That's why they are contraindicated. That's why they are contraindicated. Okay, sir, Vivax malaria treatment, chloroquine plus primaquine. In pregnancy, only chloroquine because primaquine is contraindicated. ये है treatment sir malaria. Sir malaria देखो यार, you study so much and ultimately you won't remember anything. ये देखो वन पेज में हमने सिंप्लीफाई कंसाइज कर दिया है, कुछ याद नहीं रखना है. 3 points for falciparum, multiple ring form, banana shape gametocyte and HRP2 antigen, Vivax में Shizont. Then treatment याद रखना. सर लास्ट ब्लड एंड टिश्यू प्रोटोजोआ टॉक्सोप्लाज्मा. सर टॉक्सोप्लाज्मा, राइट, फर्स्ट व्हेन यू हियर टॉक्सोप्लाज्मा, कैट आना दिमाग में. व्हाट शुड कम टू योर ब्रेन? कैट. सर टॉक्सोप्लाज्मा इज शेड इन द oocyst in the cat, shed in the form of toxoplasma, shed in the form of oocyst, are present in the form of oocyst in the cat, and it will shed in the cat's feces in the form of oocyst, then undergoes sporulation in the soil, becomes sporulated oocyst in the soil. देखो अल्टीमेटली सर याद क्या रखना है आपको? याद ये रखना है कि टॉक्सोप्लाज्मा कैट में इट इज प्रेजेंट इन द oocyst form, then it will shed in the cat's feces and become sporulated oocyst in soil, and then it infects humans causing toxoplasmosis. It infects humans. Oocyst in cat, sporulated oocyst in soil, then it enters into humans causing toxoplasmosis. ठीक है? Then what to remember? Sir, it affects muscle causing myalgia, it affects eye causing impaired vision, otherwise it affects brain causing seizures. That is not that important. Peripheral blood smear में you see spindle shape organism. This is how toxoplasma look like in peripheral blood smear. And the important test is Sabin-Feldman dye test. Sabin-Feldman dye test. And treatment, the drug of choice in pregnancy is pyramicin. So ये important points. Oocyst in cat, sporulated oocyst in soil, then humans may cause toxoplasmosis affecting the muscle, myalgia, eye, impaired vision, brain seizures. Spindle shape टॉक्सोप्लाज्मा होता है. Sabin-Feldman dye test confirmatory test है. प्रेगनेंसी में pyramicin is a drug of choice. Okay, so next important is Echinococcus granulosus. Right, you know that, right? 5 minutes में हो गया sir, last 5 minutes. In 5 minutes में we are winding it up. Sir, Echinococcus granulosus dog tapeworm. You know it is a dog tapeworm. Everybody know it is a dog tapeworm. It is present in the dog, and you know it causes hydatid cystic disease because we see the formation of hydatid cyst where in the liver and in the lung. And when you do USG or CT scan, sir, when you do USG or CT scan, what do you see? Sir, I see hydatid cyst with water lily sign, and confirmatory test is antibody by ELISA. Confirmatory test is antibody by ELISA. Treatment, sir, treatment अगर की बात करोगे, पेयर करना है, पेयर, राइट, अदरवाइज सर्जरी. सर्जरी कब करना है? जब पेयर फेल हो जाएगा तो सर्जरी करना है. ड्रग ऑफ चॉइस इज albendazole. Sir, what ultimately पूछेंगे क्या? So you have to remember Echinococcus granulosus causes hydatid cystic disease. First step, ये important है. Okay, first step. Which is the first step? Sir, first step is USG or CT scan. What do you see? Water lily sign. But confirmatory step is antibody by ELISA. Treatment, sir, first I have to perform pair, percutaneous aspiration, injection and reaspiration. Pair. If pair fail होगा तो surgery, वरना no surgery. Surgery is not mandatory. We won't do surgery. Pair, we do pair. Pair fail होगा तो surgery. Drug of choice is albendazole. This is what Echinococcus granulosus. Then Helminths causing cancer. Very, very important. Sir, remember 3 parasites causes cancer. Which are the 3 parasites? Which are the 3 types of cancer? Sir, urinary bladder cancer caused by Schistosoma hematobium species. Right, Schistosoma hematobium species. Colon cancer caused by Schistosoma japonicum species. And sir, cholangiocarcinoma caused by Clonarchis or Opisthorchis. 3 cancers हैं. Sir, 3 difficult to remember. I recommend you to remember only 2. bladder, urinary bladder cancer, cholangiocarcinoma. Sir, cholangiocarcinoma, easy to remember, CH for CH. Cholangiocarcinoma is caused by clonarchis and opisthorchis. Clonarchis and opisthorchis. Urinary bladder carcinoma caused by cystosoma hematobium. Right, sir, last topic, strongyloides. Last topic, strongyloides. After that, how to identify X. Khatam. So strongyloides. Sir, when you hear strongyloides, you have to remember the word only. You have to remember the word only. Sir, there are 4 onlys in strongyloides. मतलब 4 चीजें unique to strongyloides. Which are those? Sir, strongyloides is the only parthenogenic worm. Strongyloides is the only parthenogenic worm. Parthenogenic worm means it can give birth without fertilization. It can give birth without fertilization. Parthenogenic worm. Sir, strongyloides is the only worm that causes opportunistic infection. Opportunistic infection means, sir, वो तो पता है, infection in immunocompromised. क्या infection करता है? Gastroenteritis. Sir, it is the only helminth that causes larva occurrence. Larva occurrence का मतलब क्या है? Fast moving larva migrants. देखो, many helminths causes larva migrants. Larva migrants means larva migrate होता है. But larva migrate slowly. Except strongyloides. Strongyloides larva moves fast. And fast moving larva migrants is known as larva occurrence. Only strongyloides. Strongyloides is the only ovoviviparous worm. Ovoviviparous worm means it is the only worm whose larva is seen in stool sample. No other helminths ka larva is seen. See, all helminths have larva, but helminths ka larva, they won't come in stool sample. If you see larva in stool sample, only one possibility is strongyloides. Only one possibility, strongyloides. Yes, like you said, it causes auto-infection, but I can't say only strongyloides causes auto-infection. Other parasites also causes auto-infection. But only the 4 things. Among all the worms, it is the only parthenogenic worm. No other worm is parthenogenic. It is the only opportunistic worm. No other worm is opportunistic. It is the only worm that causes larva occurrence. Other causes larva migrants. It is the only ovoviviparous means it is the only whose larva is seen in stool sample. Others also have larva, but their larva is not seen in stool sample. मतलब कल का दिन एग्जामिनर पूछेगा parthenogenic worm, answer is strongyloides. Opportunistic worm, strongyloides. Larva occurrence, strongyloides. Larva in stool sample, strongyloides. Drug of choice, ivermectin, it causes auto-infection. Very very important. मजा आ गया ना? पहले मजे के साथ वाइंड अप करते हैं सर. लास्ट आपका फेवरेट, हाउ टू आइडेंटिफाई द एक्स. सॉरी, so many x we have, sir, so many x we have, sir, how to identify them? How to identify them? We have so many x. How to identify them? देखो बहुत सारे हैं, but important, we'll focus on important. At least remember the important. These are most commonly asked. Sir, which are those? You know, we have 3 types of helminths. Which are the 3 types of helminths? Cystode, trematode, nematode. देखो, सिस्टोड में हमें ये क्या याद रखना है? 1 egg. सिस्टोड में to remember only 1 egg, which is that H nana. How to identify the egg? Polar filaments. देखो, first you have to remember. Egg is having outer membrane, inner membrane, and embryo. Inside the inner membrane, embryo. ये पता होना चाहिए. All eggs, they have outer membrane, inner membrane, inside the inner membrane, embryo. Once you know this, if you see polar filaments in between inner membrane and outer membrane, between inner membrane and outer membrane, if you see filaments, those are polar filaments. That is the egg of H nana. 3 pairs of folklets होते हैं, but key point is polar filaments, which is not there in other eggs. Sir, trematodes. Sir, trematodes may have to remember only 1 egg. Only 1 egg is important, which is that, sir, cystosoma. How to remember? Sir, cystosoma egg देखो यार, terminal spine, right? Terminal spine, cystosoma hematobium species. Lateral spine, cystosoma mansoni species. Lateral knob. देखो, spine means sharp structure, sharp. Knob means round. Lateral knob, cystosoma japanicum species. Though I have written 3 eggs, all are cystosoma. So consider it is one. Three different species. Terminal spine, hematobium, lateral spine, Monsoni, lateral nerve japanicum, cystosoma, one trematode. Sir, nematodes. Sir, nematodes may remember four nematodes. Four nematodes. When there are four, remember 2 plus 2. Which are the 2 plus 2? Sir, first you remember ankylostoma, ascaris, then enterobius and trichuris. Right? Sir, blastomeres inside the embryo. Blastomeres ये round है ना, ये blastomeres है. These round rounds are blastomeres. Blastomeres inside, ankylostoma, irregular membrane outside, ascaris, D-shape egg enterobius, mucus plux, trichuris. Hey, हो गया man. Important X. कितने हैं सर important X? 1, 1, 4, 6. If you remember 6X, 99% only these X will come. 1% any X can come, man. Nobody can predict. But 99% only this X will come. Polar filaments, H nana. Cystosoma, terminal spine, hematobium, lateral spine, Monsoni, lateral nerve japanicum. अभी लास्ट में नेमेटोड्स दो याद रख लो. Ankylostoma, ascaris, enterobius and trichuris. Blastomeres inside, ankylostoma, irregular membrane outside, ascaris, D-shape enterobius, mucus plus trichuris. Right? Important X. So with that, sir, we have winded up with our right high yield topics. 2.5 hours लिया यार मैं. 8 बजे स्टार्ट किए, 9, 10, 10:30. 2.5 hours का सेशन है. इतना हाई यील्डिंग सेशन है FMG के लिए. Right? If you can't believe what I've told, hey, open the 5 year का question papers. Open 5-year question papers. These are the most common repeated. These are the topics from where the more questions have come and the more common repeated, and they will get repeated for sure. They will get repeated for sure. Join the DBMCI FMG WhatsApp channel for the PDF of this session, and for further discussions. Any doubts you have, you can ask here. Hope you enjoyed the sessions. Right? Hope you enjoyed the sessions. Again, maximum number of questions are going to come. Whatever we have discussed are very important, high yielding topics for FMGE. With that, guys, मैं एक चीज बोलना चाहता हूं. समझ कर पढ़ो. समझ कर पढ़ोगे, क्वेश्चन समझ में आएगा. क्वेश्चन समझ में आएगा, आंसर सही होगा, सिली मिस्टेक नहीं होगा. ठीक है? समझकर पढ़ने की कोशिश करो. एट द सेम टाइम यह याद भी रखना है. समझकर निमोनिक्स याद रख लो. समझकर पढ़ते हुए निमोनिक्स बनाओ तो इजी से याद होगा. बट समझे बिना निमोनिक्स को निमोनिक्स यूज करके मगअप करना, मतलब क्वेश्चन को समझना मुश्किल होगा, तो आंसर मुश्किल होगा, आप सिली मिस्टेक बता दोगे. यू फील लाइक क्वेश्चन हैज कम फ्रॉम व्हाट यू हैव read, but you have not answered right. Question has come from what you have read. Question have come from what you have read, but you are not, what you have not answered right. So what is the use? Question coming from the topic what you have read. Sir, why didn't you answer right? Then students say silly mistake. Why did you do silly mistake? No answer from the students. The reason is, sir, हमने समझकर नहीं पढ़ा. Right? हम बस मगब पीछे के रेस में लगे थे. हम रेस में एक रिवीजन खत्म होना है, 2 खत्म होना है, 3 खत्म होना है, 30 खत्म होना है, 100 खत्म होना है, याद होना है. बट वी नेवर थॉट क्वेश्चन भी राइट होना है. वी नेवर थॉट सर क्वेश्चन भी राइट होना है. सिर्फ रिवीजन करना एम नहीं है, याद रखना एम नहीं है. मुझे रिवीजन इस तरह से करना है और याद इस तरह से रखना है जिस तरह से आंसर होना है. इस पार्ट के बारे में हमने कभी नहीं सोचा. इस पार्ट के बारे में जरा सोचो. Sir, how can I come to know whether I'm reading or not? In a way, my question should get answered right. See, when you read and remember, when you solve questions, when your question goes wrong, right? Don't go to the next question. See why it has gone wrong. See what mistake you have done in the question. See what is the key point you have missed in the question. तब समझ में आएगा, ओ इस तरह से मुझे समझना था. This is how I should have understood while reading. Okay, I didn't understand this. Okay, now I understood it. Every wrong answer, open the notes, see the question, see what mistake you have done, why it has gone wrong, what is the key point you missed in the question, what you didn't understand in the question. Right? If you keep doing this, you will start understanding what you have read. Then your Mistakes, you will identify your mistakes. When you identify your mistakes will come down. When your mistakes will come down, wrong answers will come down. Wrong answers will come down, negative markings will come down, and wrong answers will come down, right answers will increase, sir, and your score will be better than others. With that, guys, prepare well. Last sentence, I just want to say, prepare well, prepare smart. All the best for your exams. Bye bye, see you, good night. बिग फैन ऑफ योर्स यार, अच्छा रैंक ले लो, एफएमजी क्लियर कर लो, हम भी बन जाएंगे आपके फैन। ठीक है, अभी आपकी मेहनत है मुझे सारे फैकल्टीज को आपका फैन बनाने के लिए, आपका फैन हम लोगों को बनने के लिए आपको बस अच्छे से बढ़ के एग्जाम फर्स्ट स्टैंडर्ड में निकालना है। चलो ठीक है, ऑल द बेस्ट गाइस, बाय बाय, सी यू, गुड नाइट।